Okay.
You're losing weight.
Yes.
I see it. Don't you feel it in your clothes?
Oh yeah, I'm down. I had to buy all new clothes.
Wow, isn't that beautiful?
Yeah, because I'm down like 45 pounds.
Wow.
Yeah.
You go, girl.
Yeah.
You go. I love it. Felicia, I love it. Now, are you doing shakes in the morning?
Yeah, I usually do a protein shake in the morning.
How do you do yours? Are you buying
I
this
buy
stuff?
them already made.
See, I was gonna do that too. Oh, okay.
Yeah.
But I was gonna make mine, they had this powder at Tops, and I was
Oh,
gonna try
yeah.
it, banana, any flavor. And
Mm-hmm.
it says it has protein in it, so I was
Mm-hmm.
gonna, but I really need the one with soy.
Oh,
I think I
yeah.
need the one with soy.
Yeah.
Tony.
Yeah, he said, I seen him coming up,
Yeah,
he said
he
he
had
had
to
a
check on
water
something
issue.
first.
Yeah, he had an issue.
Yeah.
Where's Mom?
Oh, he probably
Yeah.
trying to help somebody get it together.
Yeah. Oh, wait a minute.
Before he
Get
goes.
started.
Come down. That's good, Felicia. You remember you got so skinny?
Yeah, right. Yeah.
Remember, it was just a few years ago.
Yeah.
You
'cause
were
I did
like
it for-
thin.
Yeah, actually, I think I just carried the weight different because I wasn't that small. Well, I was probably
You
about
look like
15 pounds lighter than I am now.
Okay.
Actually. Okay, so we'll go ahead and get started. So today, as soon as this is, okay, and maybe, there we go, okay, I gotta use the mouse. So what do we remember from yesterday? Let's talk about that. Anything you could remember, think of that you remembered?
About HIPAA protection. What else did we learn?
Yep, HIPAA, yep.
We learned about
How to did isolation,
Yeah,
Yeah, we reviewed that.
Yeah.
What else did we review?
Occupied room,
Yeah.
clean up occupied room.
Yeah.
We also learned some customer service best
Service
practices, yep. Elevator etiquette, how to remove spots from carpets, we talked about that a bit, and equipment safety,
And equipment safety.
yep.
Yeah, we
So,
talked about cords and stuff, right?
Yep.
Yeah.
Yeah. yep, so this training we're going to do today is gonna be about 2 hours, maybe a little less. We're gonna discuss, specialty areas and the cleaning steps, which are the same, and some that are different when it comes to cleaning specialty areas. Cause as you know, like for instance, ICU, a lot of things are the same, but some things are a little different.
Yeah.
So we're gonna discuss some specialty areas. We're gonna watch a video about cleaning operating rooms. We're gonna go have a little activity. And we're gonna sort tasks according to when they occur. And then after a patient or only at the end of day in the OR. Even though we used to clean the ORs on day shift, yeah. But then the OR wanted to kind of incorporate the cleaning into their staff during the day. So then they moved FTEs over to the OR. So even though we don't clean them on day shift and in evenings, we do all the terminal cleaning at night in the OR. Then let's see. We're gonna identify things that might be different in cleaning in a long-term care facility, even though we're only gonna spend a few minutes on that. We're just gonna look at the difference between acute care and long-term care. And we're gonna watch another video that discusses the different cleaning areas. And then we're gonna discuss some cleaning scenarios in MRI rooms, behavioral health units, and then some ICU. And then we'll do a knowledge check. So that is what we're gonna do with the specialty areas and uncommon situations training, which we should be on 9.1. Yep, that's the beginning of the page, the chapter, and then it says for your learning objectives, you're gonna recognize key principles of infection prevention and control. Recognize techniques, critical role in infection prevention and control as part of the patient care team. Determine the right cleaning solutions, tools, techniques for different patient settings and surfaces. Recognize how to stay safe and as an environmental service technician, recognize how to keep patients safe, identify basics of equipment safety, and then recognize the particular challenges of working in healthcare. We're almost at the end. We went all the way around the room, so we are almost at the door. So we're gonna go over what areas require specialty cleaning or training. So have you guys ever been asked to clean an uncommon assignment like the MRI or operating room? Any of you or no? Yeah, but did you have to have training before you cleaned in that area? You didn't have training before you cleaned in the OR?
Yeah, I do have.
Yeah. I'm like, say, wait, what? Yeah. I was like, we better do some checking.
I do have.
Yeah, so depending on the type of facility that you work in, you may be asked to clean areas that are different from the patient rooms and common areas that we have discussed so far. Some of you may have already be cleaning in these areas, like Kapil cleans in the OR. And then he had to have additional training in order to clean in that area. You should be given special training in your facility before being asked to clean in areas like the OR, MRI suite, also like ICU, just some certain things like that. We also have like long-term care. We don't have anything here, but ambulatory care, doctor's offices. So those are things that it's just a little different.
Okay.
And then, let's see. So what makes some of the areas special or different, you think?
Oh, the OR being that it does special, has special things to do for special needs people.
Yeah.
You mean working in the OR?
Yeah, what's the difference? What's there, like OR, for example?
More blood in the OR, don't it?
Yeah.
Little
more.
Well, what makes it, what do you think, why would you need special training to work in the OR, you think, to clean in there?
Cause they use like a lot of sterile, equipment in there, so, you know.
They do use
you
a lot
want
of
the
sterile equipment.
patients, you know, the infection and stuff, so you wanna make sure that's really clean.
Yeah, well, like, for instance, the OR, like, you have to do, there's different cleaning procedures. Like, you don't mop the floors in the OR, you have to act, in the actual OR suites, you have to actually machine scrub them every night.
Oh, okay.
You have to map and then machine.
Are you
Yes.
serious?
We have to machine scrub the floors each night.
Every room we have.
Oh,
to-
so that's by the specialty that you're talking about?
Yeah,
the
that's like,
different-
there's different things you have to learn how to do in order to work in the OR, yeah. Like, they don't have regular, like, exam tables, they have operating exam, exam operating
Do you have to
tables.
be fast?
You don't have to be, you don't have to be fat, you have to work at a steady pace.
I mean, you're just cleaning up
There's
after
like
it's
too
over.
many
that's all.
tools over there, like
You worked in it before,
everything
sweetie?
is.
Oh, you did? Oh, okay.
Yeah, and then like, for instance, you have to check the walls for blood, cause they're cutting into people, things can splatter,
Sometimes on the ceiling.
Yeah.
On the wall frequently, yeah.
So the OR is
So
one of the
OR
rooms,
is,
The OR is definitely one of the areas that you
you really need training.
would need additional training to work in. Also, working in the MRI, like you can't take a metal cart into an MRI suite, cause the MRI machine will suck it in there.
Oh, for real?
Yeah. Yeah, cause it's metal.
I didn't get the training of MRI though.
Yeah, but you don't work in the MRI, yeah, so in order to work in there, you have to.
get trained.
Isn't that
Yeah.
Julio?
Yeah.
Yeah, Leo's here.
Yeah.
What they do with the MRI?
Well, they-
And it's just a machine?
It's a machine that takes pictures of the body, inside the body, but it's like a big
So what are you
machine.
cleaning? Just, we clean the machine?
No, but
No.
we have to clean the room. It's a big room like this.
Uh-huh.
They have sinks in there. They have, they have
Oh.
floors we clean. We have the countertops. We don't
I never
necessarily
noticed
take out
it.
the trash. We don't necessarily clean the MRI machine, but we have to clean around the machine.
Yeah, cause you don't clean inside them, but you.
No, we don't clean inside the machine.
Oh, okay.
And then like the
okay.
bench, we do all the hot, we do all the
Oh,
7
okay.
steps except
In the
for,
room
we don't,
itself.
except for the actual machine itself.
Oh.
Yeah.
okay. So what's it called?
MRI,
Oh,
MRI.
So that's one of the rooms too.
That's one of the.
Yeah,
rooms
yeah.
that you don't do.
And then like for example, like how we have the radiation training, like
yeah.
just when Jillian came and she talked about if you work in radiation medicine,
Yeah,
you go into like the Linac rooms and how they have the chimes on the door when they about to, when the door about to close. You guys remember that kind of from when Jillian was
Yes, I
talking about it?
remember her
I know I was on
talking about
vacation, but
yeah.
I know,
I remember.
yeah,
Yeah,
So
I
those
used
are
to clean-
special-
I used to clean the room
yeah.
on 6 West.
Oh.
Yeah, I think it's a few,
They used to
few
bring
of
them up
them, it's
here.
like
Yeah,
six or
there's a
seven.
couple of, there's
6
two,
and 7.
there's 2 rooms up there.
Because
And
I
then
got
we have-
locked in one and I didn't know.
And then like in nuclear medicine here, like we don't take the trash from there because they have to check the trash first. And then they call and let us know, and then Bob goes up and gets the trash from nuclear medicine from certain areas in there.
Wow,
So
nuclear
there's-
medicine?
Yeah, so
That's
there's,
one too?
that's a specialty area, yeah.
So most of the specialty areas, it's safe to say then are cleaned at night, right? Because
Yeah,
they're in
evening
use during
shift.
the day.
Yeah.
Mostly, yeah. Yeah, from our perspective, they're cleaned at night.
Oh, yeah.
And then let's see. So what else do you think? Anything else you could think of that might be considered a specialty area that we?
Is it breast clinic? Would it be?
No, that's not necessarily
No.
special. It's a specialty clinic, but not an area. Like all the
How about the dentist here?
yeah.
Is that specialty?
Yeah, well, that's a specialty, but it's not considered like, it's a specialty. Those are clinics.
Okay.
So clinics we clean in the evenings after the patients leave, but
It's not.
it's basically the 7 steps. There's nothing different you do in there that you would have to do, like,
How about
Other places.
ICU?
yep, ICU is a great example that we clean there during the day and we do discharge cleaning at night. That's because they have different beds that we don't necessarily make the beds like we do all other places.
Yeah,
So those are
ICU.
areas that you would need training, so you would know how to do things correctly.
Okay.
And the patient is really.
I never even paid it any attention. That's sad.
No, it's not. Well, you've been out of your area for long, yeah.
Yeah.
Well,
Oh, to pay that any attention, like nuclear medicine. Who would have thought?
But that's clean in the evening too, so
Yeah.
we have our restroom tech that goes and cleans some restrooms over in that area during the day, but all the main cleaning is just it's done in the evening time.
When no one's around.
Yep, when no one's around. So what makes these areas, do we got, so you got some things in there, so what makes these areas special or different? Additional equipment's needed,
Additional equipment.
yeah. And they have additional equipment in the rooms, like that aren't normally in a regular exam room or clinic. Like, especially like with the, we were talking about the MRI machines or the CAT scans and all things at operating tables. There's different surfaces to clean, like the floors, we have to, in the OR, we have to scrub them. We can't just mop them and be like, we're done. We have to physically scrub each floor every night. That's a standard. Yep, that's a hospital policy. Well, it's actually,
And what do they use? What pad? Are you using the red?
Yeah.
Red
Red
pad.
pad.
Oh.
and they have to use disinfectant on the floors in the OR.
Like
Because-
our purple?
Mm-hmm,
4, 5, 6. we have to use.
yep.
Wipe down with the 4, 5, 6 and
Mm-hmm.
like on a map it with the 4, 5, 6 too.
And then in long care facilities, they're more like home, so you have to work around the patient's items, which we
You
do.
do?
Yeah, like a long term, we don't have nursing home, current term facility here, but in the program, they want you just touch base and just know about it. Like, cause the patients are there staying, they're living there, like long term, so they have all their personal items like they would at home.
Wow, I never knew that.
So we're gonna look on, if you go to page 9-5,
Mhm.
we're gonna look at what is the same or what, or no matter where you clean. And then we're gonna think about some things that, what are different. So I want everybody to brainstorm some things that are the same when cleaning any type of room. And then write those down and then we're gonna, discuss them. So what are some things that stay the same, no matter where you go, you think?
The seven
Yeah,
steps,
disinfect.
they stay the same no matter where we go.
Yeah. Disinfect, yep, disinfecting
Yeah.
stays the same.
7 steps, stay the same and no matter where you go.
Yep. What else?
Tool- Your tools.
Yeah, my tools stay the same. No matter where I go.
What else stays the same?
Sometimes, the mop, is it?
Standard precaution.
Yeah,
So
yeah,
standard
standard precautions
precautions.
stay the same unless it's isolation.
Signs on this door? None, not really.
No, but what about the process? Would that,
clean.
yeah, would that still
How
stay the
I
same?
clean, yeah,
Yeah.
yeah.
And what's the, how do we clean?
Yeah, we clean from dirty to
Dirty to clean.
clean
No,
to dirty.
clean the dirty,
Yeah.
clean the dirty.
Yeah, I think dirty to clean too.
Top to bottom.
Top to bottom?
Yeah, top
Yep,
to
the
bottom.
cleaning process
Yes.
stays the same.
Yeah. Okay, so the cleaning process stays the same.
Yep, process stays the same. The tools we use stay the same. We're still gonna use disinfectant. We're still gonna use our dust mop. We're gonna still use our wet floor signs.
Okay, yeah, they stay the same.
Mhm.
Okay. Do you change clothes when you go in OR? So,
Yes,
Yeah,
yes,
we
we're
do-
scrubs.
Yes, we have to.
okay, so
Yeah.
that's different.
Yeah, but we're
Oh,
didn't
no.
get to different yet.
Okay,
Yep, but
okay.
that's what, yep. But now you guys wrote down a lot of things that are same. Now let's go to different.
Okay.
So what are some things that are gonna be different? Clothing, yep.
Yeah, the clothing, or uniform, or you wanna say clothing?
Oh, you can say uniform. Yeah, you can say uniform because the scrub is a uniform. What else might be different?
We have like.
A hairnet?
Yeah, well, you have to the hair.
Yep, you have to wear, yep, hair cap, yep, so your whole.
So that's a whole
uniform
attire.
changes. Your whole attire
attire,
changes. You have to wear, yep, footies, you have to wear hats,
What,
on
you
your
gotta
head,
wear footies?
Yeah,
Yeah.
over your shoes.
over your
Ain't
shoes.
they slide, don't you
No,
know?
No, it's not really, it's cool.
No.
Not
Mhm.
cultural.
No.
What else may be different in some of those areas?
The equipment?
Yes, absolutely. We just talked about how, we have to use the auto scrubber to scrub the floors in the OR.
Yeah, the equipment is different.
And how you can't bring our Rolls Royce, our stainless steel carts into the MRI suites.
Oh, you can't?
No, remember we
No.
talked about how they'll suck them in, yeah, because of the magnet.
Oh, yeah, okay.
So that's a little different.
So can't have that.
Mm-hmm.
The cleaning procedures.
Cleaning.
Oh, yes,
solutions.
the procedure, the standards. Not
The
The standards are still the same.
Oh, the standards are.
But the disinfectant is a little
Yeah.
different, because they have to use 4-5, we always tell you guys never use 4-5-6 to mop the floor. But
Oh,
they
yeah,
have to use the 4-5-6 on the floor.
So there's this different, the
Yeah,
standards are
There's
different.
this- that is the cleaning, yeah, the disinfectant that they're using is different, because they can't use, they have to use an actual disinfectant on the floor, where we just use a neutral floor cleaner.
You wanna say floor clear, right?
Yeah,
Could I
yeah,
say-
yeah, you can say floor cleaner, floor cleaner is different, absolutely.
And it actually is different because you have to scrub those floors
That's what he was just saying.
versus just mopping them.
Just mopping them. But during the day too, do they scrub?
No, they just do a
Just at
between
night.
case cleaning during the day.
Oh, I got you.
And then at night, we do what is called a terminal clean, where you have to clean.
The
Everything.
walls and
Tire,
everything.
Mhm. So you may still follow the same cleaning techniques, like for high to low, for instance, but there are going to be some differences in those areas. You won't be using the same, cleaner in a NICU, for example. We wouldn't be able to use bleach if we had a NICU here, which is a for NATO for babies, because we can't use bleach around babies.
Oh.
So that will be something different, even though we don't have it here, it's just good for you to know. Because, and then also in the spaces must be treated differently, and just as different areas as you own at home, you can clean different, you have to clean different areas in the hospital a little different as well. Now we have our first video of the day, and it's going to be cleaning the OR/procedure room.
Okay, so they're gonna show us how they do it. Okay, let's see.
And this is, oh no,
Alright.
our last video. Or, oh yay.
Military one you guys did already?
With over 2 million cases of healthcare-associated infections in the U.S. every year, the role of environmental services is more important than ever in the battle to reduce the spread of infection.
Yes.
This is especially true in the operating room, where blood and body fluids are commonplace, and patients are more at risk for infection from microorganisms. This program will guide you through the protocols for proper cleaning and disinfecting the operating room and other critical procedure areas. Cleaning an OR, or procedure room, requires a team effort, and environmental services will work closely with the perioperative charge nurse to ensure a clean and safe surgical environment. Together with infection control, you will decide which disinfectant you will need to stock on the cleaning cart. To prevent the transmission of bloodborne viruses, use EPA-registered tuberculocidal agents, such as quaternary ammonium compounds, that also have action against hepatitis B and HIV, or a 10% sodium hypochlorite solution. EPA-registered hospital-grade disinfectants should be used to decontaminate surfaces exposed to microorganisms such as MRSA and VRE. Detergent and disinfectant solutions should be prepared as needed according to manufacturer's instructions and properly labeled. Do not top off existing solutions and make all solutions fresh. If using a sodium hypochlorite solution, prepare it the day it is needed for maximum effectiveness. Label and date the container, and be sure to discard the remainder after 24 hours.
Oh, really?
Before entering a surgical suite, the appropriate personal protective equipment, or PPE, must be worn to minimize exposure to potentially infectious microorganisms. PPE may include scrubs or a scrub suit, shoe covers, head cover, latex-free disposable gloves, a mask, and a face shield to protect your eyes, nose, and mouth from sprays or splashes. Choose the PPE that is most appropriate to the task. Make sure the PPE fit well and allow for comfortable movement. During a typical day, there are 3 periods during which environmental services may be involved in cleaning the OR. At the start of each day, in between procedures, and a terminal clean at the end of the day. Before the first case of the day, all horizontal surfaces in the OR should be damp dusted using a lint-free pre-treated wiper or microfiber cloth moistened with a disinfectant. OR rooms must also be cleaned between each surgical procedure so that the next patient is in a clean and safe environment. Start by surveying the room and picking up loose trash. Hospitals have several types of waste containers and specific procedures for the disposal of hazardous waste that must be followed per facility protocol and in compliance with federal, state, and local regulations. Items contaminated with blood, tissue, and body fluids should be placed in closable, leak-proof containers or bags that are color-coded and labeled as biohazardous waste. Containers should be transported in washable carts or vehicles. All linen is considered contaminated and should be placed in color-coded, leak-proof, tear-resistant containers or bags and labeled. Used disposable drapes, gloves, gowns, and PPE that do not contain blood or body matter are not necessarily infectious waste. If you are unclear about the nature of the waste, ask your supervisor. When disposing of trash, never reach into or push the bag to compress it in case there may be protruding objects, sharps, and needles. Leave the liner in the trash container. Twist and tie the top in a knot. If the waste container bag is heavy and could break or leak, double bag it. Carefully lift the bag out and take it to the cart or trash disposal container. Do not carry bags against your body. The scrub room, halls, and utility room are also part of the sterile operating room area and should be included in all cleaning and disinfecting procedures. Thoroughly clean the scrub room sinks with a disinfectant solution, then wipe down sink shelves and surrounding surfaces. Also rinse and wipe dry plumbing fixtures above and below the sink. When finished cleaning, you must disassemble and clean your equipment in order to prevent cross-transmission of microorganisms during storage and prevent contaminating the surgical environment once it is brought back in. It is preferred that wet vacs and other equipment be dedicated to the OR to prevent cross-transmission. Mop handles should be cleaned with a disinfectant and allowed to air dry before storing or discarding, depending on the nature of soil or contamination. Also disinfect the surfaces of the cart, including the lid of the waste container. Remove PPE correctly to avoid contaminating yourself and your environment, and put all disposable cleaning items and used PPE in the appropriate disposal container. Remember to clean your hands well with soap and water, or use an alcohol-based hand rub if your hands are not visibly soiled.
Okay, so what key cleaning tasks did you notice in that video?
The test, I noticed that, yeah, that they were wiping down things and, what task did they?
Thank you, Bob.
Like they actually did use it.
And what did you notice, what they did at the start of the day? Do you remember from the video?
Yeah, they got everything prepared.
They cleaned down the metals, I mean, they was.
Did they wipe everything down at the start of the day,
Yeah.
which is a little different?
Yeah, that's different.
Yep, they wiped that, like that, so the OR cleaners that they have specifically for their area, at the beginning of the day, they have to go into each room and wipe everything down before the first case, even though it was terminally cleaned the night before.
So they still gotta wipe it down.
Mm-hmm. Also, the task between patients, they said they have to go in between patients to clean it to make sure the surfaces are disinfected before the next case.
So between
Case cleaning, or they might, or like they'll call it upstairs turnover. They'll call out turnover needed in
okay,
room
case
6,
clean.
turnover in room 4, yep. So that's between case cleaning or turnover cleaning. Then also they have the end of day terminal cleaning, which is done.
Okay, it's the terminal.
Yep. And they also talked about how the process of cleaning their tools and equipment
Yes.
and all, and then they also Showed you how to don the appropriate items,
Yeah, how you turn
PPE to
them on
wear. Yep,
turn
they
them
said
on.
how you have to wear the little
Yeah,
head
yeah.
scarf, the little footies, which is a little different than what we do in normal areas. So now it's time for a game. Whoop, whoop.
Okay.
So we're gonna say, if you're assigned to clean in the OR, we're gonna look at some tasks that you would do between case and which ones you would do at the end of the day. They kind of showed a little bit about, they really didn't show, they showed what the process was, but they didn't go over the task specifically in that video. So we're gonna hand out some cards. Are these the,
Like, pull
Yep,
both
you
cards
did.
out, yeah.
oh, and they're all separated out.
Sooner or later, we'll get this done.
So, what we have,
There's three.
there are 4 sets actually.
4 cents.
Yeah, so we could, what we'll do is we'll have you guys, Camille, you work in the OR, so we're gonna give you your own set to do. This Rita, you and Rebecca can work together, and Wanda, you and Maurice. And no cheating looking at Camille.
He's got a smile.
So what you're gonna do on you're gonna separate into 2 piles. Both piles, if you would do both, and then at between case and the end of day, or a terminal clean, or it's just a terminal clean pile. So it says, review your stack of cards, cleaning tasks to be done in both a terminal and turnover, which is the both pile, or in a terminal cleaning. Sort each card into the appropriate pile, both or terminal.
Okay.
Do not peek at answers on the back of the card. So make sure you only look at the
I didn't
front.
even notice there was stuff back there. Did you? Look at.
I didn't even know.
No peeking.
One guy is
No,
flipping, looking at it.
Mo was trying to figure it out.
Turn it over, Mo. There
There
you
you
go.
go.
Blue side only.
All right, so the turnover cleaning is like what we do in the hospital, is that what-
Turnover cleaning is in between. No, terminal?
And
I know terminal is,
Yeah, that's at night. And then turnover is in between cases, in between.
So that's both. That's both, right?
Yes.
well,
Remove trash is both.
Yes.
Yeah, that's at night, so we do that at night.
clean and around
You
scrub.
guys got 15 minutes, so you can take your time.
We don't need,
Around
yeah.
scrub, sinks,
You
must
have
lift
to
rubber
work
bands,
like, in between, I don't know, no, see,
X-ray.
And we don't really, yeah, it would be a
you know, I didn't.
We don't even
I
know.
have the board files. In between,
Oh,
in between, I don't know.
No, I was trained.
Oh, okay.
I think it's at the end of the day, cause if you
No,
think
but
it's
So do I'm
okay,
looking at it like this, I did, I'm gonna let you.
you try it,
No,
do a
no,
new
no,
one.
no, no, you gotta get that up, you three, don't go there. The next patient comes. Doesn't that make sense?
It does, but not when it come down to the sheriff, because it has nothing to do with it. Yeah, that wouldn't have nothing to do with it.
Cabinet doors is,
Floor is,
well,
remember, even though they do all the stuff at night, but you sit in between,
change out sharp
in
containers.
between, what's the name?
See, that's.
I'll give you the other
In
set.
between.
You
That's
can-
fine.
I don't think they changed out sharps in between the turnovers, you
Everything
think so?
is slower. When you during the day?
No, no.
Yeah,
I-
okay.
Okay.
We don't
Friend of
go.
the-
Or table mattress, or our table
Or
mattress,
table and mattress,
Cause, see how they wipe it down?
or our table
At the
so
mattress.
beginning.
it should be both.
Yeah, cause I saw them wipe. it
Mayo
down.
tray, what is the mayo?
You'll see, when I'm up there cleaning before you, it's, for me, that's kind of common sense. If a person's like,
Or our door
I
handles.
think that's clean before.
Light slide handles, I don't know.
After.
So some of that, for me,
Light
goes common sense,
glass,
I'm trying to remember what I saw.
No.
And I think this one is both.
The floors,
It should be all.
do they do the floors during the turnovers? They gotta clean
You
it
know,
during the
you gotta
turnovers?
touch it, it's just,
Walls
No.
will be at night.
yeah, that's a terminal thing. Didn't I have one of those already?
I don't know, we're just putting them there again.
Yeah.
And the hamper.
It's
I don't know, terminal.
I don't know what that is, but. it's okay.
Yeah, mail tray.
All right.
A mail-
Mail tray or something is in there.
The mayo tray,
X-ray viewer.
That would be, what, every day? I
It
mean,
should be,
oh,
those are things that.
Yeah, mail tray, it's just like a little, like tray table. It's a
Okay.
stainless steel tray
Okay.
oh,
table.
that's every
I
day.
have some.
I mean, that's it.
Yeah, that's just what they call them.
Oh, okay.
Hopefully they ain't got a lot of
What do
these
you mean by
questions
light
on the
glass?
test.
What do you mean by light glass?
Maybe just one, you know what I mean?
You ever
But
seen it?
everybody don't work over there.
Mm-hmm.
They have,
Light.
Yeah, we
light
only
circuit.
spend one chapter on this because it's just an overview, because everyone doesn't.
I don't even
Well,
know
it's good
some
to
of
be
the-
aware.
At the end of the day.
Cause if you ever got called to go in there, you could be like, wait, I don't know what I'm doing to go in there and clean, you know?
They'll definitely correct us, so.
Like I said, I had this training, so you know,
Mhm.
you might know a little.
Yeah, a little something.
Because I'm in a space where.
Cabinet doors should be
Correct, well, that's like.
terminal. at the
No,
end
that
of
was
the day.
my.
Well,
OR.
Oh, you used to clean in the OR there?
OR and discharge it.
Mm.
Let's try it.
Yeah.
In San Joe's Hospital.
What
Oh,
about,
okay.
This, they don't even do this
I don't,
anymore.
yeah, what's the wetback?
Yeah.
But we're gonna say
Well, you
that,
can still see the machine, yeah, the wet back, your,
Right,
since it
you're
said
just-
wet, I particularly that's.
It's a vacuum, it's like a machine.
Oh,
okay, we're trying it.
yeah.
We're putting it at the end of the day. And then the OR table,
So that's the controls, that would be something that you.
With the Mayo tray.
every day.
It's a, the
Yes.
stainless
Just-
steel
just-
tray
just-
table, you know, that
yeah.
it's on wheels.
Yeah, okay.
Yeah.
That's been 40 years ago, so you just trying to bring that back, but yeah. And we just cleaned everything, see, so,
Once. I'm
but
good.
the thing is, cause I was only up there once, see, that's.
Put it over here.
I was only up there once, but, yeah. You
Clean
didn't
it
walk
all
out that room
up.
just cause it's orange that night,
And
I'm not gonna, not wipe this, you just cleaned everything.
I know you got all yours right, right? You work
Yeah,
on
we
it.
know you got all yours,
Yeah, and there's some things in there that we just don't do, like
Yeah.
talking about changing the sharps out. I mean, we don't necessarily do it, but it's something that a lot of hospitals do.
But she was like changing them out every time they have a new patient coming in. I was like, oh, why would
Yeah,
we do that?
Yeah.
Why would we do that?
Yeah, exactly,
Cause I
because if they're not full.
Yeah.
Okay.
So you know what? Let's go over first. If you turn, let's see. Do we have it on yours? Yeah, let's turn the next page, 9.8. And we'll go over each one by one. I'm gonna start with you, Maurice. Did you have the back table?
You got a back table?
Yeah, did you have that? Would you think you cleaned that before? I mean,
Right,
between
yeah.
both or
Yeah.
terminal?
I put
I
that
said
in
both.
both.
Yep, that's correct.
So back tables booth.
Oh, yeah, but it's coming off, they're all on the next screen.
But sometimes if we go ahead,
Oh,
people
okay.
write a little bit
Yeah.
slower.
Okay.
And not only that, I've had, yeah. I'm gonna-
Cabinet doors.
That we're done.
Cabinet
What about the
doors?
Oh,
cabinet
yeah, we
doors?
just
What about
said
that, Wanda?
We-
You got that one?
Mm-hmm.
You think that would be
Both.
both? No, the cabinet doors, we only clean terminal clean, cause
Yeah,
we,
see, that's why I put it.
cause they're against the wall. We don't clean those
Oh, see,
actually
well,
during,
They does their, like, the door, I
See,
think.
why they
does the
yeah.
door.
at the beginning, but they don't do it in between.
Really?
Yeah, they don't clean the cause they only clean around the perimeter of the actual OR table.
Bed, yeah.
Okay,
bed
so
and table.
terminal is like, okay.
End of
when
day
they bring
cleaning.
it-
Oh.
Where they clean everything.
Okay, terminal is at the end of the day when they clean everything.
Yeah,
And
and
then
then-
turnover is like after one patient leaves. they
And then
clean.
right before the next one comes in. What about the floors? When will we clean the floor?
We
You know?
said both.
Absolutely.
Cause that's what said, it's great.
Yeah, we got
Come
both.
in there.
We put both
Yeah,
there.
yeah, we did.
What about the hamper? They talking
Oh, they
about,
didn't tell us that.
Just tell me no.
Both.
No, both.
yeah, both.
Both.
Yep. 'Cause that's something they use in between. That's where they're putting their
Oh,
soil
yeah,
linens
yeah,
and
yeah.
everything.
Mhm, mhm.
Let's see,
Yeah, we
the
didn't know what this glass life surface.
light
is.
glass surface,
Both.
yeah, both. Well, they,
Cause I'm thinking about those.
the lights,
Yeah.
you know how they have the
Yeah.
exam lights? They, yeah, they
That's
touch
what you
them in
said.
between, yep.
Okay, so that's both?
That's what
Yeah.
you're touching, right? That's what it, I know we had to touch them.
What about,
And because blood splatters on the
Yes,
floor.
I know we had to touch them, bring them down to clean.
So what, like a light like this?
no, it's a exam light, so it's right above the
Oh,
table.
They can
Yeah, you
pull
pull
it.
it.
Ones they pull down.
Yeah, you pull down and have to clean around it, I remember that.
What about the light side handle? What you think?
Both.
Yeah. So the doctors are reaching up with the handle, you know, they're touching that, pushing it, down, pulling it down.
Oh, okay, I got you.
What about the light switch?
Both.
Both?
Yep. The mayo tray?
We didn't know what that was, so.
That little silver tray?
Yeah.
Well, I would say both,
Yeah,
because probably put stuff
absolutely.
on and off, yeah.
Yep, that's it, where they keep their instruments and stuff.
That's not in case they want a snack during surgery or?
No, that's not,
Sandwich platter.
Sandwich platter.
Uh-huh.
The OR door handle, Yeah.
Yeah, we said both.
OR table controls. Yep, absolutely. So they're touching those, the controls,
Yes.
and, you know, if they wanna raise it high, low, up, down, whatever. What about the OR table mattress top?
We said both.
Yes, cause you have to clean the mattress, cause that's where they're putting the patient.
Remember, so before they get on it, then after they switch in between.
That's
Yeah.
it.
What about the OR table railing?
Both.
Yep, absolutely. How about the table strap? Yep.
Yeah, we know.
Walls, both.
What about the walls?
No, that's
That's
only at
terminal.
night.
I think it was
Yeah.
a terminal.
Terminal only, that's
I
right.
remember those days, something to get dressed up in the white, yeah, definitely.
What about the X-ray viewer?
Is that at night?
Yes, it is, terminal, yep. Clean in and around the scrub sinks.
That should be both.
Yep. No, actually, it's not.
And
Clean it.
That's.
So what's the scrub thing?
there was enough sink.
It's where the doctors
It's where the
scrub up
doctors-
their arms.
it's outside of the OR.
It is, that room.
Remember in the video, they showed them outside of the suite, yep.
Yeah, so there's a terminal?
Yep. Wet vac or single-use mop.
You wouldn't know how to.
The wet vac, remember we just talking about how we have to scrub the floors at night?
That's the night, yeah, that's why I said when they said wet, that's why I
Yeah,
said.
that's why she said.
So,
terminal.
some, we use an auto scrubber to do it. Some facilities actually scrub and then suck the water up with the wet vac. So it's called flood and scrub. They'll flood the floor with water, scrub it, and then suck up the water.
Yeah, with
We
like a
just use an
sidewalk.
auto
With a
scrubber.
product,
Like a
yeah, the
sidewalk.
product in the water.
Disinfectant, yep. And we just use the one-stop shop. We just got an auto scrubber, so we don't have to flood it, scrub it, and then suck it up with, we, one machine.
So the OR must be very, very clean.
It has to be.
Yeah, it has to be. Cause you're opening people up
I've
in
never
there.
even seen it.
Yeah.
Never been in one.
Oh, yeah. Yeah, it has to
Always
be.
freezing.
Yeah, it is very cold in the OR.
So there's no germs.
Yeah.
Germs can't grow.
Oh.
Yeah, yeah, the cold, you know, that's what the cold does.
Oh, really?
Germs and bacteria don't live well in the cold.
And that's why
So they
people
keep
never
it
know,
cool.
it's always cold.
When will we change out the sharps containers?
And terminal.
Yeah.
Well, that's kind of a tricky one, cause it could be both, cause what if it fills up in
Yep.
at
In
the in
between, so
between?
just put-
So you do put both?
Yeah, cause what if it's full and you got another case coming in?
Remember I said that?
Yeah,
In
that's
case- I said
like-
it,
but
say
why
between-
would it be?
I said, but in between.
It depends on how many,
Yeah.
what
You know how
surgery.
cold
Some
those things
surgeries
are?
last 8 hours.
Yes, they
Oh.
do, right?
Oh, I
Some
didn't know that.
surgeries are
That's what I
quick, but
said.
some
That's
go
like in
all
between.
day,
Oh.
depending on what they have to do and how many interest, whatever they use, the containers to fill up.
That's
And what
sad.
about the removal of trash?
That should be
Both?
That should be both. You can't wait
Absolutely.
The end of the day.
until- Yeah, for the next year.
No, both change out the, sharp, you said both?
Yeah, she said both.
Yeah, and there, just in case you missed anything, there are the answers there. Just make sure you get them all, have them all down.
Oh, yeah, yeah. You got it.
And then side note, I just asked Elizabeth about the PAPR. So the way that PAPRs work, the disposable part of it, which is
Yeah, I
Out of
seen
the
the guy
top.
use it
that's
today.
in central supply. So if there's ever not any up on the floors, which she said all the floors are supposed to have.
Yeah,
a
we
cement.
stock 'em,
We do.
What?
She
That's
said
Max.
it can be got from central supply by either the nursing supervisor or your manager at night. And then the battery pack is always housed also on the floors, but if it's not there, it can be gotten from
Obtained from,
SPD.
yeah.
And there is an area in the basement where they can have extras, but she said definitely, they're always on 8. She mentioned specifically 6 West and a couple other floors, but she said if they're not there, these are the places, it's like a 2-step process to kind
Yeah.
of get them if you need them.
Found
She
out
said, no,
today. I
obviously
just
we
found
use
out
it.
today where
Yeah.
they were, and I seen somebody use them.
We'll make sure like all the managers have that information too, just in case like the new nursing supervisor isn't around and you need to reach out to your manager instead. And obviously we don't want to hold up the process, so.
So if you're fit tested for the N95, that's your
Yes,
better
I
option.
put that on.
It's
this
just
one.
easier, it's
It was just
quicker, it
the
accomplishes the
nurse
same
has so much
thing.
face up here,
Yeah,
so I went and found
exactly.
them
If you
one.
have a lot of facial hair, you can't wear the N95 because it doesn't form that tight seal.
Yeah.
And you can
yeah.
actually
Oh,
call
yes,
down to
yes.
SPD, she said, worst case scenario, but ideally the nurses are supposed to put the battery packs back where they're supposed to go, but
At the end of the day,
sometimes
right?
goes awry, yeah.
So we didn't make up all these answers and
No.
discuss why they did it. Actually, remember I mentioned earlier about the AORN, that is the Association of Perioperative Registered Nurses, and they come up with all the standards for working in periop areas.
Oh, they do, the nurses.
Yeah, well, it's an association where they come up with, yes.
Okay.
And they come up with the guidelines, the guidelines and everything for working in all periop. Cause perioperative includes, you know, PACU, endo, and then ASC, which is ambulatory care, like right before. So pre-op, like before they go into the surgery, then they, you know, during surgery and then after. So it's that, the whole wing of the third floor, which is on the hospital side of the third floor, is all perioperative space.
Sad to say, I've been there before.
And then let's see, we also have an AOR, we also have AORN toolkits available on their website if you ever were interested in looking in there. And then also on page 9-9, you can see the AORN toolkit website and also the practice guidance for health care environmental cleaning, right there on 9-9 in your book.
The AHE, which now you are familiar with because that's who put this class together, and you will have a AHE certification as a chest. They actually have a whole separate training session specifically on cleaning for OR. So there's a whole other certification that you could actually get just for OR cleaning.
Really?
Yeah, that's how detailed and
And do they work on the weekends?
Does who work on the weekends?
OR.
Yeah,
Only for
OR
emergencies.
here?
yeah.
Yeah.
They'll do emergency cases on Saturdays, sometimes Sundays, but usually not. They're not
They
scheduled.
don't schedule anything, but only emergency cases they do.
Anybody can work up there?
In the OR? Yeah. But we have some of our people.
But I gotta be properly trained.
Absolutely.
Definitely, you have to have been up there, because there's, as you can see, there's specific things that are different there than, and we're giving you kind of an overview here of what those different things are, but just
But it
because,
gets grosser.
just
than
because
what
we've
I
read
see?
them, doesn't mean we would send you up there
It
to
gets grosser
have.
than what you
Some,
see?
yeah, cause some cases are bloody.
Yeah.
I mean,
You have to know when you move
You
that
can take
bed.
some are light, but some you really get, you know,
Like 14, 15-hour cases there.
Mhm.
Blood everywhere, like
Yes.
dry up the blood, we have to rinse the
I got to
water.
close my eyes and keep going.
oh, dry.
No, you have to open your eyes.
Yeah.
You gotta look for it, you gotta
You
find
have to
every.
look
every
everywhere.
spot.
You guys
It's
see
special
everything?
way, no, it's
Everywhere, look like.
So another specialty place that we may be asked to clean is a long-term care setting. Even though we don't have one here, if you were ever to go to a different hospital, they may have one, like for instance, Sisters Hospital. They also have a long-term care facility attached right to them. So some of their cleaners do go into long-term care spaces. So it's good just to have a little overview of it. So if it's, let's see, long-term facilities have extra cleaning needs that you may not see in a hospital or other care settings. Does anyone have experience with long-term care settings? Has anyone ever
Yeah, I
cleaned?
worked in a nursing home and I cleaned.
Okay, so what did you notice? Okay, so what do you notice in this photo, Rebecca, that's a little different than what we would have in a normal?
That chair, her personal chair is different.
Yeah.
They wouldn't have a personal chair, but, and her lamp
Mhm.
is different.
Yeah, it's more like, yep, one of the lamps from home.
Yeah, even that carpet down there, I never
Yeah.
seen that.
Absolutely. So there's quite a few things on here that's
Plants,
different,
you
yeah,
know,
plants, and we not, yeah, we don't
You
have.
can't have
The
plants.
flowers, I
Yeah.
think.
Teddy bear.
Yeah,
Yeah,
the personal items.
Yeah, all her personal items is different. I mean, compared to a hospital.
Yep. So you're just required with your chest certification to have basic knowledge of long-term care facility, even though we don't clean it.
Mhm.
But you just, with the program, they want you just to have a basic knowledge of what things could be different. So did you, if you're on 9-10, just write down a few things that you noticed in the photo that would change the way you clean. That we just talked about. Yep, there are more personal items,
Mhm.
more breakables, I guess you could say.
And then honestly, it looks like, since it's that little rug type thing,
Mhm.
that you would literally actually have to vacuum that probably.
Yeah.
And then with a wet mop around it with the floor. I'm looking at that, so that's different.
Yep, that's
You have-
absolutely
you have to
different.
do both, yes.
And then in the long-term care facilities, we actually have to schedule a detailed cleaning because they're there so long, we actually have to go on a rotation to say like every so many months or something, you go in there and do a full detail cleaning.
But this, can't you do a standard cleaning in that?
Absolutely standard, but you can't, like, you wouldn't pull up the,
Carpet?
the carpet every day and then,
Yeah.
things like that, move all the personal items every day in the long-term care facility.
You couldn't do that.
Yeah, I mean, cause the bed's on the carpet, so you
Yeah,
can't just
that's
say,
it.
can't scoot Mr. Jones or Mrs. Jones out the way, let me just scoot you out and we'll pull the carpet out. So those are more like detailed things that you would just schedule. And then also in long-term facilities, they all usually have food in their rooms too.
Mm-hmm.
So,
Because
which is a
they
little
do-
different, that they keep in there, that they
Oh, like a
their-
refrigerator? type of
Yeah,
thing?
they'll have like a refrigerator or have their snacks on the counter
Yeah.
and things, so it's not like in a hospital room where we just removing the tray, cause they might have things in there that'll stay in there.
In there,
Mhm.
right.
And then also, the relationships are a little different that you form, cause you're cleaning, you see that same person every single day.
Yeah.
Kinda like similar to Five, cause you
Yeah,
build
I
those
see them
relationships,
everybody.
cause they're there for a long time.
Mm-hmm.
So that's a little different in a long-term care facility as opposed to more where your patients are there just a few days. So you don't really necessarily build that long-term relationship with them. And then some things to be sensitive about the age appropriateness, you want to keep in mind, like communication with residents in long-term care facilities. You also want to draw them into conversations if appropriate, ask them questions about their life, just to kind of like show the customer service side, because some of them don't have people that visit them every day a lot.
That's why I always say, did you ever have a garden? You know,
Mhm.
when I
Yeah,
have gardens,
something.
everybody sort of does a garden.
Yeah,
So everybody got something to say.
yeah,
And that's how
exactly.
that's how I break the ice.
Absolutely. And then also maybe use age appropriate language. You don't want to, if it's someone of much older, you don't want to use too much slang that they might not understand what you're talking about. If you say Facebook, they might not know what Facebook is, things like that.
Mhm.
And then watch your non-verbal cues and body languages, because they may,
Watch your non.
what non-verbal cues, like, your gestures or body language. And don't talk loud just because you think someone's old. That's a key thing.
Oh.
Yeah, just because they're old don't mean they can't hear. So that's something also to keep in mind. And then all those are on page 9-11 too.
Oh, they are?
Yep, if you want to just highlight them.
Oh, yeah, let's go. Wow, you got me writing.
But it's good to write, because what we
Yeah,
say,
'cause I don't
writing helps
forget.
you learn.
Yeah, and I don't forget.
Yep, writing helps you remember. So now, okay, learners, let's see. Outside the hospital, there are many different types of facilities a CHEST, Certified Healthcare Environmental Service Technician, might be asked to work in. So actually, we do have one more video. It was above the last video we watched. They just weren't in order. So we're gonna look at a few of those areas that you may be asked to clean outside of a hospital.
The video?
A video. Yes, one more. They weren't in order. Let's see, wait, there we go. This one's first. Well, this one's the last one. Ambulatory.
When people are ill, they seek treatment or tests in a doctor's office, ambulatory center, or retail clinic. They may bring with them any number of disease-causing organisms, potentially spreading illness to other patients, their families, and healthcare workers. These organisms can thrive on frequently touched surfaces, such as furniture in waiting rooms or exam tables, and can live for days, weeks, or even months. Ambulatory settings are now under closer scrutiny when it comes to infection prevention practices. This is why it is critically important that cleaning and surface disinfection protocols be performed properly and consistently by environmental services personnel. The waiting room and reception area is where first impressions are made and where many disease-causing organisms may be found. Your goal is to make this a clean and safe environment for patients and visitors. Begin by performing hand hygiene with either soap and water or an alcohol-based hand rub. Next, put on the appropriate PPE required for that setting before entering the work area. Look for and pick up any loose trash and remove newspapers for recycling. Books and magazines should be straightened, and magazines that are visibly soiled or torn should be recycled. When removing waste, never reach into or push on the bag to compress the trash. Leave the plastic trash liner in the container and close, twist, and tie a knot in the top of the bag. Then lift the liner carefully, making sure to carry the bag away from your body. Place the bag of trash into the container on the cart or take it to the waste pickup point. Wipe all surfaces of the waste container with a disinfectant solution and allow to air dry before relining the container with a fresh trash liner. Approach cleaning in a logical and organized way, from back to front, in a clockwise or counterclockwise direction around the room, and from top to bottom. Cleaning from top to bottom will prevent dirt and soil from dropping onto lower surfaces that have already been cleaned. Begin by cleaning with a microfiber cloth and neutral cleaner. And squeeze so the cloth is damp, not dripping wet. Or apply the cleaning solution to the cloth directly from a squirt bottle in a stream. Note that spray bottles should not be used, as this disperses the chemical into the air and may pose a risk for anyone with respiratory issues. In addition, never put a dirty cloth into a bucket of clean solution. Instead, use a clean, damp cloth as needed. Fold the cloth in half, then in half again. This will provide you with enough clean surfaces on each cloth to ensure dirt and pathogens are trapped and removed, and not just spread around. Clean the windows and glass, including the doors and partitions, with a clean microfiber glass and mirror cloth. Then damp wipe windowsills and frames with a microfiber cloth and germicidal solution. Dust, then disinfect surfaces, starting with the highest areas and working down. Wipe countertops with a damp microfiber cloth and germicidal solution, changing the cloth or wiper as needed. When cleaning furniture, be sure the furniture can withstand the chemical and use in accordance with the manufacturer directions. Clean vinyl or faux leather furniture as needed with a microfiber cloth and cleaner, and spot clean fabric following manufacturer guidelines or facility management instructions. Pay special attention to high-touch surfaces, such as the arms of chairs, tables, light switches, door handles and door frames, and remote control if applicable. Wipe the TV and other electronic equipment, including the cords, with a clean, dry microfiber cloth approved for electronics and no-scratch surfaces, as chemicals can damage the screen. Vacuum the floor in the entire area. Any spots in carpeting should be removed using an approved method if necessary. Carpets should be cleaned on a regular schedule, not only for appearance and cleanliness, but also to prolong the life of the carpet. Remember to move furniture back where it belongs after cleaning the floors. If cleaning hard surface floors, first vacuum or dust mop with a dry microfiber pad. Then place a wet floor sign at the door to prevent slips, trips, or falls. The wet floor sign should remain in place until the floor is completely dry. Damp mop the floor with a flat mop and an approved cleaner to remove dirt and any sticky residue. When you finish in the area, remove your PPE and perform hand hygiene, and complete the quality checklist to make sure every step in the cleaning process was performed. These are the cleaning and disinfecting actions you should take on a daily basis to clean the waiting and reception area.
So there are some things that stayed the same, what, like the cleaning process? As they said, top to bottom? Yeah,
Clockwise or
yeah,
counterclockwise.
standard precautions, yeah, absolutely.
Clean and dirty.
Clean and dirty.
And they also started saying wash hands, use PPE.
Yeah,
Yep, so a lot of those things are the same. And even though these are considered specialty areas, like for Wanda and Sharita, this is just part of their normal routine at night.
Mhm.
Yep, cleaning the waiting rooms and everything in the clinical spaces. So what are some key tasks that you noticed from the video?
and how to wipe, how to, clean a surface, with using a damp rag, solution. Or ours would be peroxide.
Yeah, well, they did show that. They also showed that things like ambulatory doctor's offices, ambulatory care centers, and retail clinics, they showed that it's very important to clean those. Why did they say?
To stop the spread.
Yep,
Yeah.
stop the spread of, yep, stop the spread of infection. And also, they also showed the steps for cleaning a waiting room and reception areas. They showed that they're similar to cleaning in a hospital, because they use the same process, the cleaning process. They said clean top to bottom. So, and then also the PPE and hand hygiene was the same
Was
as
the
well.
same,
Yep.
yeah.
So even though they're different, they were the same in a lot of ways.
I mean, do you actually throw out all the newspapers though?
Yes.
Yeah. So.
You do?
Mm-hmm.
I mean, even if the next person they read them?
Yeah.
I mean, whoever's the
Because then,
visitor.
we don't even put new newspapers in there anymore, but we do throw them out because they're old and you have people constantly touching them. You don't wanna,
Yeah, yeah, yeah.
and then they get, like,
Yeah.
especially with the
Okay.
magazines, they
Yes.
kind of stopped it. We used to get so many
Yeah.
magazines.
I'm starting to
It
see
used to
them.
look, yeah, it used to look horrible. And then they would get
Now.
all worn and people would spill stuff on them. Yeah, we would throw those out too.
Oh, okay.
Yeah, the volunteers used to bring magazines in all the time. We used to couldn't stand it.
Yes, I
Yeah,
know, I
bless you.
seen you do that in the waiting room.
Bless you, yeah.
Remember you went through and you
Yeah.
took away everything, I was
Yeah.
like, wow, she took all of it.
Yeah, cause then they get dirty and people are constantly touching them and, yeah, they just, when they get like that, they just don't look nice and we don't wanna
Okay.
have things looking kind of cruddy. So, let's see what you remember about some areas. They talked about ambulatory care centers. And those are cleaning and disinfecting and examine treatment rooms. It's very similar to a patient room, would you say?
Oh,
Very,
yeah.
no, it's very similar.
Yes.
Oh,
Yeah.
it is?
And what about, let's see, what do you remember about waiting rooms?
They're pretty similar.
Yep, what's some things that you do differently in a waiting room that you wouldn't do in an exam room?
As far as removing things?
Yeah, like for instance, your solarium upstairs, what do you do differently in your solarium that you don't necessarily do in one of your patient rooms?
Well, normally I clean.
Vacuum.
Yeah,
Yeah,
vacuum,
vacuum.
yep, exactly.
Yeah, that is.
And then they have a sink in there, so I clean the sink, that's what I'm
Mhm.
saying.
And then like, what if they had blankets and stuff, you would pick up the linens and stuff in there too,
All
right?
the old linens.
Yeah, and you would arrange your furniture a little, yeah,
Yeah,
could they move it out of this place?
Mhm.
And what do you think when we're cleaning a doctor's office would be different than an exam, look, if you were cleaning like a patient room or?
I don't know, it would be different as far as disinfecting his office.
Yeah, what would, yeah, like say you go into a doctor's room, a doctor's office, say I have all these papers on my desk, would you move the papers?
No, that was a personal item. I mean,
Yeah.
you gotta, you
See, but
gotta
that's
plan.
different, yeah, you wouldn't move those.
It's, well, for some people they will move, 'em, but I have to move them because it's the way that and the doctor, the way that they're set up, that black, you know, that office, it gets dusty. So in order for me to get the dust, I have to.
You gotta move the stuff?
Yeah, well, you don't have to, but
No.
it's just.
Like,
Lift it, you
if
just
you go
lift
into a
it.
doctor's office and they have 100 pieces of paper on their desk, are you gonna touch one of those pieces of paper and move it out the way?
The thing is.
Yeah, yeah,
yeah. Well, because you- aren't we putting wet stuff on there?
Exactly, you can't do it. Yeah, we don't touch personal items. So on things like that, if it starts to get dusty, we'll ask them, would you like us to, dust your area, but on
Is
a
that a
regular
Pacific
basis.
cleaner, a detail cleaner? Would you have them do
No,
it?
we just have the person that normally would clean their office do it.
Oh,
Like a CSC, for instance, David and Murder work in CSC, and those are specifically a lot of doctors' offices. They don't touch their personal items when they're
no.
cleaning. And then, cause then they have a lot of research, they could have a lot of research papers or anything on their desk. We don't wanna disrupt that. So those areas we would just clean at, those specific things, once the doctors move the stuff off. But we wouldn't just go in there taking their papers, moving them, cause if you put something back out of order,
Oh, yeah.
it can get a little,
Yeah.
it can get a little,
Yeah.
And the clinics, even though, so the clinics are pretty much similar,
Uh-huh.
but what is different in the clinic that you would say? Cause you clean clinics and you clean like patient rooms here, what's different?
Clinics be having more beds in there, don't they?
Not necessarily, no, some clinics don't have beds at all.
Oh, they don't?
Oh.
They have exam tables.
Chairs
Oh,
and
they
tables.
got
Yeah,
plenty of them
What's
little
different that you
tables, yeah.
clean if you was in the hospital to your clinic?
I don't know, because I would disinfect everything.
Yeah, that's it.
But think about your chemo bays. They don't have a bed in them. They're different. They're not like a patient room. They have chairs and they have overbed tables, which is
Right,
the same.
so.
But
it's
the
the
chairs are
same.
different than a bed because there's different surfaces.
Okay,
There's
so they would
different
have
things you have to
chairs.
get between the cushions and on the side. So they're a little bit
Yeah.
different.
What
in
about
terms
doing
of what's there.
mammography? What's different in one of your mammography rooms than like a room on 7 East?
Cause I have machines in my room. That's
Exactly.
what's different, I have machines
Hey,
in my
Austin,
room.
what's up?
Yeah.
So yours would be machine?
Yes, I have machines in my rooms, yeah.
Mhm.
Up
And
there.
that's different, yeah, than a,
I'll call them and find out. I mean, it was sometime last night. What is that after? That definitely would have been after.
and then procedure rooms, like in the OR. So what's the difference between cleaning an OR and a basic patient room, Kapil? What's different?
Like the different instruments.
Yeah, absolutely.
What did he say?
Different instruments.
Oh, yeah.
And like chemicals like.
Oh, different
differences, yeah,
chemicals?
Different chemicals
Mhm.
used.
And then one key thing in a lot of these places, most of them are cleaned after hours.
Okay. That's the difference? too?
Yeah, a lot of, yeah.
After hours.
Like in the ambulatory, the waiting rooms, we clean those, after hours. Clinics, we clean after hours, the procedure rooms. The only thing we don't clean after hours, well, we clean some. We clean some physician offices during the day,
Yeah.
then some others after hours. So that's the only one that we clean, but normally they're cleaned after hours.
Yes.
So we're gonna look at some safety precautions in specialty areas. So like you may be asked to clean an MRI, I know we talked about this before, or in a behavioral health unit. We don't have behavioral health here, but if you were over at Buffalo General, they have one there. I used to work there and we used to have to go into the behavioral health unit and clean in there with the patients in there. Or if you were at Children's Hospital, you will have to go into a NICU possibly. And we have to recognize that there's special safety concerns when going into those areas that you need to be aware of. So we're gonna turn to page 9.14 in your guide to see some scenarios.
Okay.
So let's see here. So you'll have 5 minutes to review each scenario and then document what you watch for in each situation. For example, the first one says, the last task on your day's assignment is the MRI suite. What should you watch out for? And then go through the list. There's only the top 3 scenarios there, and then we'll talk about them.
Go through the list that we just went through.
Nope, these here, just answer these questions here
Okay, all right.
on page 9-14.
All right.
It's only actually two situations, actually.
You should just watch out for.
Yeah, what should
Yeah.
you watch out for?
Well, we know you definitely cannot take that cord in there. That's not.
And if you think you can't bring in a metal cart, what else can't you bring in? If you think you can't do that, there may be some other things you might want to be aware, think of. It's like, oh, if I can't do that, I better not do this either.
Can you wear jewelry in there?
No,
I'm just saying, no.
No?
no.
Magnetic, like a instrument, like a
Oh,
cell
yeah,
phone.
he said
Yeah.
it's like a.
Cell phone,
you
dude?
can't-
Not
not
cell phone.
even
We
know
cannot
that.
take inside the cell
The
phone.
MRI,
Okay,
I ain't never knew that. Where the MRI building, we got a building. right
Not
here.
building, it's on the second floor.
On the second floor?
Yeah.
Oh, I never been in.
I said personal items, so you should watch out for those.
Yeah,
Mhm.
definitely.
So is it coming up from the ground?
Well, we think from the drain
Oh, okay.
caps that are underneath the carpet.
So did no one check it?
What do you mean?
Or did they go down there?
We extracted it
No,
last
yeah, I
night.
know we did.
At
but
like
I
by
thought-
10:30, Mario was finished with it and it's wet, it's like sopping wet.
Yeah.
So they're just trying to figure out.
Oh,
moving
okay.
forward, so we're gonna do it again tonight.
Right, well, we should watch out for,
And then for the second situation, you are entering a behavioral health unit to assist another technician who is behind on their assignment. What do you think you should remove from your cart or avoid leaving in the rooms in a behavioral health unit? What do you think? Just think about it. Behavioral health means that there's mental,
something wrong.
so what wouldn't you bring in there and what wouldn't you want to leave behind? Just think, if someone was mentally disturbed, there's certain things that you wouldn't want them to have access to, right? So they won't hurt themselves? Just think about something like that. And then also, if you're cleaning in an occupied NICU with babies in it, what would you do differently than cleaning a typical occupied patient room?
NICU room?
Well, no, that's NICU. Yeah, that's like NATO, like
Oh,
babies.
like babies.
Neonatal,
babies.
yeah, neonatal ICU. So it's basically an ICU for little preemies and little babies.
I'm just saying, I wouldn't use bleach.
Yeah, that's definitely good.
What else would you do differently?
You go in
You're
there,
not doing a
gonna
typical
go in there
room.
banging pots and pans.
So what's the
and buckets
first thing you
around.
do when you go into a occupied patient room?
Knock on the door.
And what do you do after that?
I say,
Would you do that to a NICU? Would you go in there and knock on the door and introduce yourself to the baby?
Oh, no.
Because they wouldn't understand, right? I mean, right?
right, so you didn't knock on the
I mean, you
door.
could, but they ain't gonna respond. Well, they might start crying if they hear you.
And what's true about all babies? What do we try to do around babies?
Be quiet.
Yeah.
Right, exactly.
That's what I wrote,
Especially-
be quiet.
Especially like preemies who
Mm-hmm.
are very sensitive to noises and light and everything else. So you wanna really be cautious about your noise levels and, you know, banging mops and buckets around and stuff like that, loud vacuum cleaners,
Wouldn't go in there, and, yeah, turn on the TV.
crank up the music.
Yeah. So for the MRI suite, what should you watch out for? What do you guys have written there? What are some things?
I said,
Magnetic devices like a cell phone.
Yep,
I said personal items.
yeah, personal items, absolutely.
Any metal at all.
Yeah,
Yeah.
jewelry,
So
like
like
you
jewelry,
said.
Yeah.
earrings, glasses, wrist, bracelets, anything like that.
Gotta
Nothing.
come off.
Name tags that have metal on, any metal whatsoever. You
What
can't
if
go
you have
in.
metal frames like eyeglasses that you need to wear? Should you wear goggles over them?
You
or-
shouldn't go in.
So you're saying there's a machine in there that pull
It
everything
will
in?
pull it in.
So if I was to go in there, right, the machine be on all the time, or that just when the machine is on?
Well, you cannot go in unless you know that it's safe to go in.
Yeah.
So even when the machine is off, there's still a very strong magnet in the machine.
Cause I done walked by there before, I never,
Well, it's a secured area. You can't get in there unless you can't get into the actual
Yeah, I
MRI
know, I see
suite
it's like some double doors.
unless
or
you're
something.
allowed
And you
in.
gotta scan in or something?
Yeah,
Yeah, okay.
like
You have
I've
to have
seen,
Card access, I think.
yeah, you have to have
Yes.
card access and they'll only allow you in there even with card access when there's a technician in there. So like Julio, who cleans up there, can't go in there even unless there's a person in there. Unless there's a qualified like MRI tech in there. Because they know every single thing that can and can't go in the room. They know when the magnet's energized. But I've seen pictures of, I actually saw one physically in person of one of our side-by-side buffers, you know, those big heavy buffers that they scrub for in the MRI.
Yeah, right across the
It got
street.
sucked into the MRI, like
Buffalo
right
General.
across the room.
Oh my goodness.
Yeah, because somebody thought they were doing a good thing. Oh, I'm gonna scrub the floor.
Oh my
And they brought this thing in, the magnet was on, it actually like took it out of their hands into the MRI and caused like
Is that strong?
Yeah.
almost $1
Is
million.
that strong?
Yes,
Mm.
yes, it is that strong. So absolutely no metal whatsoever. If you had this on and this name tag on, you walked in, it would rip it right off you and whip it across the room. And so it's a good thing it's quick release or it would take you,
Yeah.
your glasses, your earrings, anything that's metal would just suck it right
Off
in.
my wig?
I
Is your wig
know.
metal? If you got metal in there, yeah.
I
She has bobby pins.
Yeah.
Better hold on tight.
Oh, that's funny.
So you're entering the behavioral health unit to assist another technician. And is there anything that you should remove from your car or avoid leaving in the rooms there? What's some things you have written down?
I said I wouldn't bring chemical solution in this.
Sharp things.
Sharp things, absolutely.
That's what happened.
Cell phone.
Yeah.
Like they might
Yeah,
take
yeah,
it,
they
like
take
personal
sharp
stuff.
That's what happened on scraper, but
Oh,
sharp.
Yeah.
things,
You
sharp
have, like your chemicals, you have to keep those locked up, yeah? You have to make sure the door closes behind you so no one escapes.
Oh, yeah, yeah, you have to make sure the door is closed.
You can't leave wet floor signs in there because they can use those as weapons. After the floor is dry,
I
you have
said
to.
mops. I said mops, you can't leave a mop.
No, you can't leave that either.
Yeah, because they'll use that as a weapon.
Or your trash bags. We can't use plastic bags.
Oh,
That's right,
yeah,
because, yeah,
We had to use paper bags in them.
Oh.
Yeah, because they can use those to, suffocate, strangle, so you can't use plastic bags. And then it's one important thing to really look out for things that are broken, like broken dispensers, anything like that can harm the residents there. And I know we already discussed this, but if you're cleaning in an occupied NICU, what would you do differently? What did you write?
I said I wouldn't use bleach.
Yeah,
Yeah, and.
Watch the noise level.
Yep, and the noise, absolutely.
Yeah.
Hey, what do MRI stand for again?
MRI, magnetic resonance imaging.
Got the magnet right in there.
That's good for you.
Magnetic what?
Resonance
Imaging.
imaging, yeah. Don't ask me how I know that. I've just been around hospitals way too long.
So let's turn to page 9.15 and we're gonna do a little review. What are some things that stay the same no matter where you clean? What are some things that stay the same? What did we
Our
say?
standard.
Yeah, the cleaning process.
Standard process.
It's right there it's right behind, is it right in between Capil and Becky on the wall there?
Okay, standard.
Yep, clean the dirty, top to bottom, one direction, clockwise, counterclockwise, that stays the same. So we talked about this in the chapter, early in the chapter. What is the Association of Perioperative Registered Nurses? Remember we talked about, discussed what AORN is?
Oh, they do the guidelines for this,
For-
cleaning or something?
Yeah, absolutely. It's the association that represents nurses who work in healthcare operating rooms, commonly referred to as AORN. The association, with input from AHE, of course, sets guidelines about how operating rooms should be cleaned. So they actually give the input and set the guidelines on how operating rooms should be cleaned. And what specialty areas require additional training? OR, MRI, absolutely.
And I see you, right?
Yeah, yeah. And also they had noted here, even though this is just part of our regular days, but doctor offices. Because
Oh,
you
they
don't,
put that down too?
yeah, because you don't want to go moving things in doctor's offices. You don't want to move all their papers around and all their
So that's-
items.
That's called specialty.
Yeah, that's considered, even though it's part of our daily routine here at this place, but a lot of hospitals it isn't.
It's not, yeah, cause it's more like an office.
Yeah.
My office is bigger than this room here.
Mhm.
So it's like, you know.
Yeah,
Oh, okay.
so it's just part of our daily routine here, but it's still considered like a specialty. So name 2 special considerations when cleaning in a long-term care facility.
Like
Personal
personal
belongings?
items.
Yeah, definitely.
Yes, personal items, personal belongings, absolutely.
How you talk to them, like.
Yeah. And also there's less frequent discharge cleaning in a long-term care, long-term care. There may be carpets or rugs in the rooms. They may have food also. And one of the things that food does is attracts bugs. So we have to make, you have to make sure you're kind of like sweeping up crumbs and everything and checking that and checking for any infestations.
Oh, they check for that too?
Yeah, absolutely. You gotta keep an eye on things like that in long-term care. Cause food attracts bugs. That's why we don't allow people to store the cans, stock cans. That's one of the reasons why we don't say, you know how we say always toss them out? You see them building up, toss them out every single day? Cause they attract fruit flies. Name 2 areas outside of a hospital a healthcare environmental service technician may need to learn about cleaning. What are some areas? We already said these areas
I have 2 areas outside of the hospital.
outside of a,
Did we say nuclear medicine?
No.
well, yeah, you could put that, but it's like, cause that's part of, cause nuclear medicine is part of the whole of the imaging, where MRI is.
I think of areas outside of this hospital,
You
though.
like nursing home?
Oh, outside of the
Yeah.
hospital?
Like outside of the hospital proper.
Yeah,
So what are
outside
some
of-
areas that we clean here that are different
At the
than,
tower.
yeah, that
Oh,
are different than
outside
the
of,
hospital itself? So what do we do outside of the hospital here?
we clean labs.
Yeah,
Yeah.
that's one area, labs.
Yep,
Yeah, we
Clinics.
Clinics.
Clinics that
Yeah.
are not necessarily always at the hospital, like the Amherst Clinic, we don't
mhm,
necessarily clean that. We have a contractor that does it, but with the new Amherst Clinic, there's talk that we might be cleaning that. The new one that they're building, so.
And don't we clean that park outside, the Kaminsky Park or?
No, not
Well,
really.
grounds-
We assist.
mostly grounds
Yeah.
does.
Yeah.
We'll clean up like our tables and chairs when we,
Oh,
when we have an event or something. But labs, offices, those kind of things that are outside of a hospital proper.
we don't clean the parking lot, do we?
no.
No.
So what is a special safety consideration for MRI suites? So what are some things you have to take into consideration before entering an MRI suite?
Oh, no metal objects?
Yes, no metal, no electronics. You have to use special designated equipment. You couldn't go in there with a metal mop stick or anything like
There's actually
that.
special mops and mop buckets and mop sticks to go into that area.
So no
So right
metal,
to-
No metal whatsoever.
special.
Including Becky's wig.
I know, wasn't it going straight there? I can see it now.
So now, guess what we're gonna do?
Hey, Rick.
Yeah, we can take a break, and then we're gonna wrap it up.
Play a game. Play a game.
Oh, I was gonna say, I get to go back to my floor early?
You probably will, but we're gonna, we got a game to play and we got to wrap up.
I know, because I've been having complaints and
Don't worry about it.
every time I come on the floor.
I don't know you're here, but you're not there,
Yeah, I
yeah.
told him Friday, I swear, I'm gonna straighten you out.
So we'll meet back here. It is 10:26. No, we'll be back in five minutes.
Okay,
Some
I'll take a
coffee.
break.
An hour, yeah.
It's more than two bathrooms, but
I know, but no, I'm saying, but right there,
Right
right
there,
close,
yeah.
close.
yeah. mines at home. I don't
All
know.
right, you guys get one more spin.
She said she's gonna write that down. That's a good one, though.
5.
Keep your money close.
Oh, yeah, and then you get the 10,000. Oh, and I forgot to move this 10,000. So
So
we're
then-
at the 30, so we got 2 stars.
So when we go, what do you want?
You go out and then you gotta go get
So
back
I'm up
around.
here, so
So you
what,
Yep.
gotta come back in, right?
Yep, you go back in,
what direction?
down.
Down towards you.
One, yeah,
Yeah.
one.
1, 2, 3, 4, 5. Okay.
Waste, I should say. Pharmaceutical waste is considered what type of waste? Pharmaceutical waste.
Come on.
Pharmaceutical, hazard.
Yes.
Wow, y'all making up some money, ain't ya?
Yeah.
Okay, now it's on you, Sharita.
Back to Sharita.
5.
Sit in.
You're in.
She's in.
10,000.
Were they right here?
Yep, they go on the floors. Okay, now,
Come on,
Sharita,
10,000.
for the $10,000,
boy.
what are the first 3 steps in the mopping process? First 3 steps.
First 3 steps in the mopping process.
Yeah, the whole process. What do you do?
Show, like, have you
The
start
steps.
them out?
Yeah.
What do you do?
What's the- how-
Say, okay,
Just
so
say it.
what are the steps you have to do?
Get the stick.
Oh, no, in the mopping process, the first thing you have to do, is put up the wet floor sign.
Okay.
What else?
But if I'm gonna mop the floor, I have to dust mop it first.
All right.
And then I wet mop it.
That's
Yeah,
it.
yeah, that's it.
Did I miss
That's
anything?
it.
No,
No,
that's it.
you
So
did
you put the
good.
details,
You
yeah?
did
My mind
good.
went right to when I started mopping the floor. Like, oh. But I have to do it upstairs, because they're gonna have to do it in the lobby. I'm trying to go back upstairs.
That's what they want.
Put that sign down.
Don't
first.
overthink
Did I
it.
miss-
10,000.
See, that's what
Don't
you
overthink it. You
Yeah,
guys
yeah,
know
we
the
got
answers. You do
10,000.
it every
I
day.
know, but.
Okay.
No, it's good, especially when everybody's
Oh,
waiting for
she,
you to
you get to
answer.
come out now?
Yep, you get to come out now.
Okay. 3. We came out with 3.
Yeah, you came out, oh, wait, you're on safety. Oh, this is our first, no, we got one more safety question. When removing isolation room PPE, what article of PPE should be removed first?
My gloves.
Absolutely. Thank you. Okay, Phil. Linen.
Linen. Oh.
What makes a specialty bed different than a typical bed?
I know. Specialty bed, a hell room. That's a specialty bed. What do we do different?
Yeah. So what makes that bed different than a regular bed?
Yeah, then we have a regular bed as far as cleaning and everything else. with it.
Bed mattress.
Okay.
Possibly. That's not what they're looking for.
But they're
though.
not what they're looking for.
What are they always moving from floor to floor? Oh, we need a blank, blank, blank bed on
Yeah,
something.
Or ISO air bed.
What's different on the beds?
Man, they got like.
Linen.
Yeah.
No, linen's the same.
It's not that, it's not.
Like the connector, the pipes, string.
That's not what they're looking for.
They're not looking for that.
You can help.
Can I help?
No.
It's a group.
Oh, yeah, it's group.
Oh, it's a group. Oh, okay. It being like different from it being air in the mattress is different in the bed. You have to clean it and put a bag on top of it.
Yeah, so what's different?
You don't do that on a regular bed.
What do you do when you go to the grocery store and you do what to your vegetables? You put them on the scale. For
Yeah.
what reason?
The weight.
Oh.
It has
So the
weight.
specialty beds may contain a scale or other electronic equipment that may change the way they're cleaned. That's why we don't clean the hill rounds, because they have different equipment on there. Yep. That's okay.
The weight and everything. We got them on our beds too, but they different.
Yeah, they have different electronics on there.
Different electronics. So we gotta stay still.
Yeah,
We don't get anything.
6.
So I'm going back down here.
Yep,
Back
That
down
ain't
and
here.
then over, cause we gotta go back
Oh,
up.
you're not green.
You're not
Oh,
green.
yeah, you're not green.
You're the little white guy.
1, 2, 3, 4, 5, 6.
Where
Okay.
you at?
Oh,
Did they
this is
give
our first infection question. What is the difference between standard and transmission precautions?
Standard is always,
Yep,
and, the other one is just,
Transmission is isolation room.
yep. Yeah, absolutely. And then transmission precautions are used when standard precautions are not effective to break the chain of infection. But you got it right, yep. Standard is always and transmission is for isolations. Okay, Wanda, you're up.
oh,
You're a doodler like me.
Oh, yeah.
Oh, you guys were, this is, no, they were there, I think.
Yeah, we
You were
were,
there?
remember?
So we
Oh.
are over
Right.
here.
We
Oh,
did
no, you
that.
were there.
Yeah,
On
we
the
did
left.
that.
Yeah, that's
we
you.
did that.
That's on
so
mine.
we
Yeah.
gonna go on to, we
One,
back in,
2, 3, 4.
no, we gotta go
Yeah, you
back.
gotta go up and down, up and down. What was that? Oh, safety. Oh,
Safety.
Okay. Ooh. What is the safety procedure for exposures? Say you were exposed, you got a needle prick or something. What's the procedure?
You say the name.
Yeah, we
So
did
with the
that.
management first,
What else do you have to do?
and
If you were stuck by a needle, what would you do right away?
go to the HR, to the unemployment help.
What else would you do?
Say the name.
Twice
Say-
Oh, save the needle.
And what else would you do before all of that if you were stuck with a needle?
Save the needle, go to the reporter with the management
Mhm.
and wash my hand.
There you go. Yes, you got them all.
Wash your hands.
You wanna wash the space
Yeah,
area
wash the
immediately.
Oh, wash
Yeah.
your face.
And then go to, yep, then save the needle, go to the
Save the
help.
needle.
Oh,
Go up
wash
to
those
the help.
spaces.
You wanna, yeah, if you got, you wanna make sure you wash anything
Ready?
that could be
No.
on there.
Come on.
Yes,
Oh,
you
these
are.
guys have another.
Oh, no, yeah, they got to do their
Their
team.
third roll.
Okay.
Their team roll, six.
No, you go to the
Okay.
wrong.
Waste.
No, you.
Did
Huh?
you go, did he go?
Yeah, he
to
went
the
to the other row.
To the
He
wrong
went to the
one.
wrong row.
You went to
Yeah,
the
he
wrong
went
one?
to the
I
wrong
think
one.
that's good.
This is the Lenny, he go to over here.
Oh,
because I
okay,
was
got
over
it.
here.
Shouldn't he
Oh,
go
yes.
He
in to
went
get,
to the-
Okay.
yeah.
Oh,
that's
yeah,
good.
so we got clean.
I got infection.
Infection. Oh, another infection question. Name 3 things you do to break the chain of infection.
Wash your hands.
Yep,
Use
Use
proper
PPE.
PPE.
yep,
And
Uh,
your health, don't be sick and stuff
Yeah.
like that.
Don't be
Yeah.
sick when you
That's
come
it.
in.
don't,
Yeah.
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 Don't
They
be
didn't
sick
put all
when you-
over, there's 3, they put hand hygiene, PPE,
Hand hygiene.
isolation precautions, cleaning and disinfecting, but
job.
we did say, don't come to work sick.
Yeah.
It helps break, yeah,
Cleaning and disinfecting.
yep, cleaning and disinfecting.
That's it.
I'm sorry, yeah.
3, that puts you on
1, 2, 3. Go ahead.
safety. Okay, Sharita. Describe an environmental services technician's role in a safe and clean facility. What's our role?
To keep it disinfected, to keep it safe and clean.
Yep. Technicians clean and disinfect throughout the facility to ensure a clean and safe environment for customers. Absolutely.
Awesome, good job.
Yeah.
You okay, girl? You okay?
It's a long citation.
So
Oh,
we're in the,
You're in here. No, because this is only, yep,
Oh, we're not in there.
not yet. The next
So
one coming
close.
up is either those.
Okay, so
Nope,
No, that-
Maurice just
Oh,
moved you.
oh.
You got a waste question. What type of waste is cardboard?
it is, we put that in the recyclable.
There you go.
Right.
Booyah. Yep.
Yeah.
6, all right. Okay,
Right there.
Open my phone just in case.
okay.
Another
You
safety
looking at the
question.
answer?
They look at
Yo.
So what is the Hicks model used for? Remember we talked about Hicks? I think that was on day 2.
you.
Hicks.
What heck stand for again? Oh,
Hospital.
hospital
Incident
incident
command
command
system.
system.
Yes.
There you
Yeah.
go. Yes. And that, when we used that, like COVID, we went into incident
Hicks.
command. Yeah, the Hicks system, yep.
The Hicks system.
Yeah.
Say, what is it?
Well,
Hospital?
that's
Hospital
like
incident
tornadoes,
command
earthquakes,
system.
and-
I got it
Yeah.
written down, it's in the book, but I would.
It's the incident command. Oh, yeah, it's right behind you too on the wall.
Oh,
See,
okay.
that's what kind of incident command system.
Yeah,
Yeah.
Alright. Who turn is it?
That's your.
yeah, back to you.
Oh, you wanna do both? Oh,
He's like the whole one.
Oh,
Where am I, right here?
Mm-hmm.
yeah.
Where I go backwards? I
Yeah.
already did that one.
Yep, right, that's, you gotta get to the next one.
Oh.
No, you're good though. Yep, right there. Sharps needles are what type of waste?
Sharp needles are,
Medical.
What is it called? Yep. What is the whole term?
it's the-
Medical,
It was the last one. What was the last one? Hazardous, like.
No, it's not hazardous.
No, it's a medical,
Yeah, that's what said.
Or they call it RMW.
Remember?
Or they call it RMW, which is,
it's a
Radioactive
medical.
waste.
do you say radioactive? No, it's
No,
not
not
radioactive.
radioactive.
Sharps aren't radioactive.
Yeah.
Oh, my goodness.
I remember.
I know the RMW, that's not the exact wording though.
Yeah, me too. Me
So I don't
too.
remember exact word, but memory said R.
It's called,
Regular medical waste.
Yes, regulated medical waste.
Regulated.
Yes.
Alright,
All
I
righty.
had it
It's on you,
right.
Wanda.
alright. I would've got it if, I seen it. I just.
Especially what you see like the initials, right? Make it easier.
Yep. You going down?
One,
Nope,
Down.
down. You just got over there.
where,
So-
Down, down,
yeah.
and up.
1, 2, 3.
Oh,
Have
hey.
we had that one before?
Floors. What cleaning solution is needed for a patient room?
Neutral?
Yes, NutriCleaner, yes, absolutely. Okay, one more time for you guys. One.
Where am I? Right here?
Yep, right
Yeah,
there.
that's it.
Got communication.
Oh, that's the first
So
one.
what do you do if you want to help a coworker outside of your assigned area?
Help them.
Yeah,
You want to?
yeah, say if you want to go help Wanda, who works in CSC, what would you do first?
Contact the supervisor?
There you go. Yep,
Let
you would ask permission from your supervisor.
them know.
Okay,
Alright.
5.
We're going up or down?
We going down.
Down.
1, 2, 3, 4.
And then over, okay. A florist question.
I know.
Demonstrate the proper vacuum technique in a common area. What are you doing, okay?
Just vacuum.
Up and
What are you,
Up and
okay,
down.
okay, and then what are you gonna do? What else is some things you do when you're vacuuming? What are you looking for?
Well, see, the way I vacuum, I literally vacuum with my hands because of the vacuum that I have.
Mhm.
So like the staples and paper and it'd be little rocks and I don't pick up things, you know. I try to avoid them and sweep those
So
up.
say if you had to vacuum this room, where would you start?
Oh, you start from the far end?
Yeah,
Yeah.
perfect,
That's
yeah.
what I want.
This is just
That's
like
what
what
I
I was doing in the room.
Yeah.
So that's how I remember. So
Far
it's just
end.
like, yeah.
Yeah.
I thought she said, what you looking for? I'm looking for.
Yeah, and you looking for
That's my
spots on the carpet?
Yeah.
Yeah, so you get to report them?
I pick up so much stuff. Paper clips everywhere.
Yeah,
I can't let them mess with the vacuum. So I
1,
have to pick them
2,
up.
3, 4, 5. Another safety question?
yep. Okay, when would you use soap and water to clean your hands versus alcohol?
And when I'm in a contact plus room,
Yep, when else would you do it?
and I would do it every time I go into a room.
Well,
Daily?
you don't necessarily have to wash your hands with soap and water every time you go into a regular room. But you should, contact plus, absolutely.
Uh-huh.
And when else should you use soap and water instead of alcohol? Like before doing what?
Oh, before procedure or before, when do I use this stuff? I know this.
What is it, what you gotta do what?
It says, when would you use soap and water to clean your hands instead of alcohol rub, which is
Oh,
Perel?
that's how you come out like an airborne room or something, right?
What, after a contact
I
plus, you
already
would
said
do
that. I
it.
already said contact plus, and
You will also do it 2 other times.
and I would do it when grabbing garbage.
That's not, well, no,
But it's
you
not on there?
can use alcohol for after you grab garbage.
Bathroom, restroom.
Yes, using the restroom is
Yeah,
one.
the
Oh,
restroom.
after you come out.
Oh, after I'm finished cleaning that room, Oh,
Yeah,
okay.
like if you use the restroom, you should use soap and water, wash
Soap
your
and
hands.
water.
Just like the
Before you
daily
eat.
And
Yeah.
before you eat.
Before you eat, and if they're visibly soiled.
Oh,
Yeah.
visibly.
Yeah.
Visibly soiled. Did we get it?
That's supposed to
Oh,
be.
yeah, we got it.
That's the group.
Yeah.
It's a group.
It's a group.
6.
Yep.
We doing
Yep, yep.
6 inspection.
Okay, infection. How many links are in the chain of infection? Yeah, absolutely.
Y'all already moved?
Yep, 4.
Where am I, right here?
No.
No, that's one.
Yeah.
We going up? and
Yep,
down?
up.
We supposed to
Oh,
go
this
same
one.
direction.
You go up, then down, then up, then
We
down.
going about, okay, we going,
You go.
y'all passed us?
Yep, they did on the last one.
On the last.
So, in a C. diff isolation room, what should be done with the Johnny mop after cleaning?
Throw it out.
Absolutely, you throw it out.
Wow.
Yep.
Throw it out.
Because you see that.
4.
2, 3.
Alrighty.
No, we haven't had that clean.
What type of disinfectant is recommended for cleaning a C. diff room?
Bleach.
Yep.
Oh, we got
All
one
right,
more
yeah,
row.
one more row. 3.
We going down?
Down, yep. Okay, where is, thank you. If a nothing by mouth patient asks for water, what do you do?
Ask the nurse
If they can have
supervisor.
it.
Yeah.
Yes.
Absolutely, you inform the nurse.
Yeah, Wanda getting it now.
Yep.
Oh, yeah, she got one.
Plus you got 3.
I want my data.
Okay, Lennon.
They got money involved, she said, oh my.
What is a facility power level? What is a power level?
Remember with the laundry? The par? The laundry cart has pars on them?
Yeah, so what is that?
So if it's
It
a.
tells us the amount. Tells us the amount.
Think about it. Say on your linen cart, there's a power level sheet. What does that
Oh.
power level sheet tell you?
That's the thing is, I don't have that, but it would.
Yeah, you
don't
No,
have
you
that,
do.
But it will tell you, what you have and what you don't, how much,
Yeah, how much linen?
Yes,
How
yes.
much linen you need?
The amount of linen.
Yeah.
Yes.
Which is totally different, because I have one where they
Yes.
got the plastic things in front of
Yeah,
it.
and then right on there, it's a little
It's a little
card.
card.
How much
No,
linen
that's
is
it. I
this?
never even-
How much
No,
linen
no,
you
but
need to
Everybody
put
never
in
paid
there.
attention
Because I
to
don't
it.
use that, that's why.
Yeah.
I did linen before, so I know.
When I clean the room,
It's
see, that's what I'm saying, I have linen.
eliminate, Lenny.
Yeah, the
It's a
power
card,
level
like,
is a
it's-
sheet on your
It's a
cart,
sheet
your
on
linen
your
cart.
cart.
It says how much linen does this cart need?
Cart need.
But what is the
Oh, but see,
answer
that's
for
what I'm saying.
that?
Oh, the answer is the level of linen that you
Oh, the
should,
label,
yeah, the
the
level
The
of
amount,
linen.
the amount that you can have in there.
Yep.
I'm actually gonna look at mine again.
Yeah.
Oh, yeah, I know,
use
because
that
I was
one.
in
Yeah.
linen.
No, it's one, it's in a different room.
Yeah, I know it because I was in linen
I have to
before, so
definitely
that's
put
why I
stuff
do it.
around, that's the only thing I focus on.
Yep.
But I don't do linen, because I don't.
Oh, it's my turn. That's how I knew it.
Okay, 6.
We need that,
1,
remember.
2, 3, 4, 5, 6.
All right, a clean
Oh,
question.
gosh.
What general concepts stay the same no matter where you clean?
The concept is
Yeah.
stays the same, standard.
That's
clean.
what
Yeah,
thank you.
yeah, well, like for instance, what's the, what is it? What stays the same no matter where you clean it?
Hand
Our
hygiene.
hand hygiene and mops,
We'll say the same
their
amount.
equipment.
Yeah, well, like, remember we talked about it? It's on the wall.
Standard precautions.
I did, I said standard.
Top to bottom.
Oh,
Yeah,
top to
standard-
bottom,
standard- Yep,
top
exactly,
to
that's what they're
bottom,
looking
clean and
for.
dirty.
Yep, the cleaning process stays the same no matter. You always do top to bottom, clean and dirty, and then your basic cleaning tools stay the same.
Yeah, basic cleaning tools.
No change.
That's what I was saying.
Yeah.
tools.
All right, another 6.
We can go in.
Not yet, you only can go in when there's a line to go in.
Oh.
So you gotta work your way up to the next one.
3, 4, 5, 6.
Okay, infection. List 2 common mistakes that can spread infection in a facility. What's something that can spread infection that,
Too common.
Oh, common?
Yeah, what's common that, what like can spread infection if you don't do what?
If you
You
don't
need
take,
to wipe the ITOS surface area.
Okay, yeah, that's
Uh,
something. What else?
You can clean, disinfect that like.
That's the same.
toilet.
No, that's the same.
Like,
So what else? What's something common?
like the proper use of the PPE.
Yep, not using PPE.
Not using PPE.
They also put not performing hand hygiene and not covering sneezes.
yes.
Yeah. Those are the, that you only had to list two, but
Oh.
those are some other examples they put on the card.
Okay.
One.
Oh, yeah, we're going up.
Good one.
Down,
Down, yeah.
Okay, you got a safety question. So what do you carry laundry and trash away? Okay, no, why do you carry laundry and trash away from your body?
Cause before you won't get infected with.
For contamination.
Yeah.
Contamination.
To keep contaminants off your clothing and to protect yourself from possible sharpness.
Okay, y'all go again.
Yeah.
That's me.
Okay.
He said, let us get me some money.
Yes.
Yeah. so-
I need some money.
High roller, yes.
How you like getting the money?
Oh, yeah.
Yeah, you was right.
1, 2, 3, 4.
Five.
But
Five
Oh,
over
we have to
here.
go here.
Yep, go there, yep,
Go
You go here,
there.
right?
No, you only go there
Here.
when you get here.
yep.
So we
Oh.
have,
You got floors, right?
floor.
Okay, Wanda, thank you. When does a hard surface floor need advanced floor care? So that means when does a hard surface floor need something other than mopping?
Oh, when you in one of them, MRI rooms or
Nope,
one of them, or.
or, no. So say you go into a patient room, you mop it every day. When will there need to be extra stuff done?
Contact.
Oh.
No, has nothing to do with that.
When would it be extra?
Yeah, when do we have to do other things? Cause what other procedures do we do to floors besides mop?
Dust.
No, we wax. So.
That's
Who's
different.
side floor?
Was in the picture, when we seen in the waiting room, we were looking at the floors and they had stuff on it.
Move stuff.
No,
No,
Hold up.
so it says, when does a hard surface floor need advanced floor care? So advanced floor care is the question. Yes, when it's scuffed up, when it has marks or stains. Yeah.
marks and stains.
Yeah, when it's scuffed, yeah, when it's scuffed,
And marks and stains.
yep, you got it. All right, all right, one more
One
time,
more
guys.
time.
4,
Oh, yeah. I ain't going
yep, going
No.
over and then up. Okay, you got a clean question. What is the Association of Perioperative Registered Nurses?
Same way.
What's the Association of Periodic Nurses?
Perioperative Registered
Oh, they the ones
Nurses.
who, they make the rules for the cleaning,
Where?
for cleaning, for, in the hospitals.
Nope, where at specifically? Remember, we just talked about it, perioperative
Oh, in
registered
the-
nurses.
Oh, and like in the OR. and-
Yes,
and all
yep.
that.
No, that's,
No,
green.
that's us.
Green.
Oh, it's green with us.
Okay,
Another floors?
Yeah.
you see a spot on the floor that you can't remove, what do you do?
This part that I can't remove.
Yeah, say you can't remove a stain on the floor, what do you do?
If I can't remove stain on the floor, definitely I would cover it over, well, not cover it over, but I would report it because it has
Yes,
to be moved.
absolutely,
It has
you
to be
report it to
moved.
your supervisor.
You know, the first place my friend went to, that lobby. When I
Oh,
had used to
yeah.
be calling them,
Mhm.
telling y'all, stay here.
Staying here.
I just, cause that's a big.
Oh,
floor.
one.
Fucking picture.
Really?
Went to-
Communication,
Really? One,
if a patient or family member asks for directions, what do you do?
I help them get the directions and I also ask them that, ask the secretary.
Yeah, perfect, yep.
You can take it away.
You stop what you're doing and you,
ask for
you know,
help,
yep,
you
you give them the help, yep.
Me too.
Oh.
One.
We gotta stay behind, aren't we?
Another floor question. So when do you clean a floor if an occupied, well, no, when do you clean the floor in an occupied patient room?
At last.
Yep, the last
Last
step.
step.
Yeah, that's what it
Last
says,
step.
as the last step after completing all cleaning. Yep.
Okay.
3. Okay.
What you get?
When should you answer a phone call? When should you answer a phone call?
Never.
No, when you out on the
What you
road.
mean?
Yep.
I'm
There
seeing-
you go.
Oh,
You're away from the direct
You said
station.
never.
Yep, never.
No one
Okay, so you're saying you want to never answer the
That was different, though.
I'm in the place of phone, sometimes I be cleaning the phone. She said that's different, we don't answer the phone, we won't.
phone? 6, oh, good. No, you could go in.
Yeah, you
What do you
go
mean?
in.
Oh,
You go
because-
in.
Oh, yeah,
You
but you got
can go
6.
in.
Yeah,
Yep.
you in.
Linen.
Yeah.
Describe how to transport linen to a utility room. Say you have a soiled linen bag, how would you transport it to a utility room?
Away
Out
from
in the
you.
body.
Yep, keep the soiled linen container.
Yeah,
Yep, away from
well,
your
I got
body.
10,000.
I got my money.
10,000.
Yeah.
They got another one, that's 20.
Another one.
Yeah,
got another one.
We move up
You move up, there we go.
Until
Well, the
you
whole
get-
team,
Wow.
until you
yep,
get to 100,000.
yep, we need 100
Oh, we
Gs.
got another road there.
Yeah.
So we shoot two
Well, we
now.
have to talk.
No, we're not doing two now.
Oh, that's
You got
six.
20,000.
Wait,
Coming down one day.
Coming down, yes, there.
You're inside here.
Oh, 5, 6.
okay, clean. Name 2 special considerations when cleaning in long-term care.
Personal items.
Yep.
Personal items,
Yeah.
And food.
Food and stuff.
Yep, perfect, those are
Yeah.
2, yep, that's 2 on here.
Personal
Yep.
items and food.
Yep, they have personal items, less frequent discharge cleaning,
Yeah.
possibility of carpets or rugs, and food items in room. Yep, you got it. Who is it? Was that your group one or yeah? Okay.
Yeah.
6, all right.
Only got 6.
1, 2, 3, 4, 5, 6.
Okay, communication. Demonstrate how you would enter an occupied room.
You would not first, you would not first.
And then,
And then you would announce, yourself and.
Yep.
let them know who
Introduce
you are.
yourself.
Yeah,
Absolutely.
introduce yourself, yes.
that's perfect. That first, introduce yourself.
All of you
Say who you
talk
are.
about it, everything you're doing.
Yeah.
Yeah, girl.
One. One.
My
I'm
business.
sorry.
You're getting forwards a lot. What should always be done? No. What should always be on the floor when mopping?
Yeah, that's what it looks like too.
We
right?
should always be on the floor.
Yep, what
When
should
you're
always
mopping.
be on the
Oh,
floor?
shouldn't be?
What
No,
should?
What should always
Yeah.
be there?
Before you mop
I
floor.
always put out my wet floor sign.
There you go.
That's what
Yeah.
that looks like too.
Yeah,
2.
1, 2.
No, that's
Ah!
you right before the room.
Right before that. Next
I was
time.
ready to. It don't feel
Oh,
bad.
another floor, another floor.
So you got another floor
She
question.
do a lot of floor.
If your mop head is unusable, what should you do? If you can't use the mop head you have, what should you do?
if I can fix it, I try, not I report for the
No.
maintenance.
No, what should you do? No, if you say you have a loop mop and you
Oh.
can't use it, what you gonna do?
Change
Change it, replace it, that's all, just simply replace it.
Well, yeah.
Yeah.
When you think about a machine, when you said you can't.
Yeah, just the mop, yeah.
With the machine,
Oh.
you know, it's that mop, right? I'm thinking about the machine.
2,
Oh, yeah, right here.
yep,
You going this way?
yep. Another floors. I know, right?
Ain't gonna have no more left.
There's a divot in the floor of a patient room, what should you do?
What?
A divot in the
Like-
floor.
like a dent.
Yeah,
Like a
yeah, like a
dent.
dent or
Like a
something.
dent.
Yeah, you
Yeah.
report it.
Cause they got, we can do about that. That's-
Nah, nothing can do it.
Look,
Yeah.
that's
You report
construction,
that.
that's construction, fix that.
Yep.
You can't.
3.
Mhm. Ooh, they be going in a minute.
Yeah,
So that's 3.
yeah, what is that? Oh,
That's a
infection.
I say germ.
Okay, Wanda, name 3 things environmental service technicians do to prevent infection.
Wash your hands.
Yep,
Use PPE.
absolutely.
And change clothes.
No.
You got it, Wanda, you got it.
PPE is, goes in with clothes, yep, so,
You got
what
it.
else?
Clean socks.
See?
Yep,
Disinfectant.
yep, absolutely. Yep, this is,
Disinfectant.
and disinfect's on here too, but you only had to name 3, yep.
Waste, like,
Oh, we do it again.
correctly, handle the waste correctly.
Yo, yep,
To handle the
Oh,
waste
right there?
correctly.
you, now you in, safety.
Ooh, y'all got
Let's see,
another
let's safety,
10,000?
yep, yep.
How they getting 20 and we ain't even nowhere
What
near this?
standard PPE do
Oh,
you
we
wear
going
most
this
frequently?
time.
Gloves.
Yeah,
Gloves.
Yes.
definitely gloves.
Gloves.
Clothes.
What else do you wear? What, name some other ones you wear most frequently?
Man.
The mask?
Mask.
I mean,
Yep.
we know what.
Yep, masks, absolutely.
Gloves.
Yep,
What,
what, yep. What was the last one you said?
Gowns.
Yep, gowns, gloves, and masks.
Got
Yep, those are the most frequent ones.
Well, where's
Get
the
that
second?
10,000.
Oh, my.
So we can
God,
go.
yeah, y'all got 30,000.
Yeah.
Why we only got
Yeah,
10?
like, see, I gotta keep going.
Well, you almost there.
Gotta keep going, just keep going, it's just a process.
You
It's a meeting.
about to get it now, though, once you guys roll the answer.
Okay, go ahead, let's see if we can get it.
Go cash. them.
Yep, you're in, winning. Okay, for $10,000. Demonstrate how to document and report what linen went where. What would you do? What would you look at? We
Did
did,
that thing that you said.
What- what's that thing
I don't know what
called?
it's called though, but I know you said the
Just
card
had-
thing.
just had
Park.
that,
Park.
just
Okay,
talked
the
about.
park.
Yep,
what
the
is it
park
called?
sheet.
Yeah,
Yep,
park
the
sheet.
park.
I'm like, the linen. I don't do those things, that's why I'm like, how?
Well, you
You
can
can
remind.
let it
Get
go.
money.
Yep, now you
Get
know
money.
you got it.
Yay, we got 20. Yay, we
Okay.
got 20.
we need 2 more to make $100,000.
I'm doing 1, 2, 3, 4, 5.
Waste. Bodily fluid is what type of waste?
It's considered, bio. I know it's called bio, but it's called, bodily fluid. Oh, what kind of waste? It is hazardous.
Nope.
Oh, wait a minute, it's medical.
Medical.
It's a medical
What'd you say?
fluid, regulated medical.
Here you go,
fluid.
yeah, regulated medical waste.
The regulated,
Yeah,
that's part I
it
can't
just-
remember, the regulated part, I can't remember that. Yeah.
I got 2 on me.
You got 2. Okay, linen. What is the process for safely removing linens from exam tables and beds? Remember, we watched a video on this.
Remember?
Make
Keep
a
it away
ball.
from-
like
Yep,
a-
roll the linen into a ball.
Uh-huh, then put away from the body.
Yep,
and then
absolutely.
put on a-
Oh.
What do you use? What type?
Gloves.
Yep,
Gloves.
There you go.
Down.
Yep,
Get
there you go.
Yay.
Boy.
Which way we go up?
No.
No, you're still going down.
No, you're going, now you're going up, yep. Communication. When do you recommend to
Yes.
turn down noise?
Close the door.
Yeah, when though? When do you recommend to turn down noise? When would you turn down the noise?
If somebody complaining about it,
Okay, what else?
when I turn down the noise, if I'm by a patient room or something.
Yeah, by patient's room, yeah,
And we turned down the noise in the baby, remember?
yeah,
Oh,
absolutely,
I
yeah,
forgot about that.
When
See,
we
cause
go
we
in the
just did
end,
that,
see,
yeah.
what's the room?
Nikki?
Nikki.
Yeah.
Yeah.
Perfect.
Consistent with that stuff, yeah. We'll come to Nikki. Baby, that was back to baby.
Mhm.
Ooh.
Oh.
You were right here, remember?
Just did that.
She actually let
Oh, yeah?
Danny.
Okay, what was that? Oh, linen.
Oh, that's another linen question.
Okay, when is it recommended to change a privacy curtain?
Isolation
Yeah.
room and private rooms.
Yeah, isolation rooms, and when else will we change it?
Remember when we see a what on it?
Splash.
Yeah.
Again.
Yep.
Oh, it's a splash, okay. I got that.
4.
1, 2, 3, 4.
Okay. Safety. What should you do if a vacuum cleaner has a frayed cord?
Report it.
Yep, you report it. You stop using it and report it.
Unless you got some duct tape or something.
What?
Like that.
Electrical.
3.
1, 2, 3.
Okay.
There you go.
Demonstrate proper lifting techniques for lifting something over 50 pounds.
Anything that you with, you bend.
With your knees.
Yeah, you
With your
bend
knees.
with your knees, not with your back. So
Yeah,
you bend.
that's exactly.
But I have to
Bend
know
with
that
your
because,
knees.
oh, Lord, please.
Yep, it says ensure that you bend with
Yes,
your knees
yes.
and don't strain your back.
Yes.
Yeah.
You need to wait a bit,
Yeah,
you need to wait a bit,
perfect.
you need to wait a
Yay.
bit. Oh, not just standing up and.
Come on.
All right, well, that's good. So-
1, 2, 3. Oh, is he going in?
Yeah.
Yep, you get to go into safety.
Yay!
Let's see. How was chemotherapy waste handled?
Chemo was, therapy waste is handled, in a bin.
Put it in the red bag.
It's always in.
No, you don't put it in red. No, you don't.
It's a medical.
But it go, you wanna know where it goes?
No, I just want to know how it's handled.
It's handled, we make sure that,
It could go into two categories. What did we talk about? It can be either
Or medical,
regulated medical, yeah.
Oh.
What else? What else?
Or
And if it's
hazardous.
bulk, yep, hazardous.
Hazardous.
So if it's bulk, it's hazardous, and if it's trace, it goes in the regular.
regulated medical.
Yep.
Oh, we gotta remember that too.
Two.
Oh, we
Oh,
get
yeah, you
that
get your
now.
points. Yep, you got that.
Got to go this way?
Yep. Oh, wait, and I have to move it up. We won,
That's
we
the
10,000
real-
away.
So we can get there.
The DOT, which is the Department of Transportation, considers employees who dispose of regulated medical waste to be what type of employee?
Remember, it had to be a person that did it, and Bob is the only one that
Oh,
does
you gotta
it.
be trained?
Yeah, they have to be trained, but they're considered, what's the word? Him and Chris. They have to be
'Cause they're gonna do
certified.
it for
All
law.
certified.
Yeah, but that ain't the word, it's hazmat.
That's
They have to be
hazmat.
hazmat
Remember,
certified.
'cause it's
Hazmat certified.
Hazmat,
Yeah, cause they said they're
Oh,
gonna get
hazmat.
local
Yeah.
coming next.
Oh,
hazmat.
you got to be hazmat to.
You have to certify, yeah.
Yeah, cause they box it, remember?
Mhm.
They box up some and seal
Okay,
it.
they call them hazmat.
That's me.
Clean. What specialty areas will require additional training? So what areas?
OR.
Yep, the
Yeah.
OR, what else?
MRI,
MRI,
ICU.
Yes.
yep,
And the baby.
yep.
Yeah,
you
the baby.
got it.
You know, you spend a lot of time with the baby, so I see that, so thank you, yes.
Okay, Mo.
Oh. Got it.
Alrighty. Name two categories of waste. Two categories.
Solid waste
Solid waste, yep.
and regular medical waste
Regulated medical waste,
And
and hazard waste.
hazardous waste, and then,
Regulated
yep, you only had to,
medical
and then there's recycle. Yeah, but you only had to name the two, but you
Oh,
didn't, yep.
nice. Oh, is it, no, it's his turn again, right?
No.
No,
But that was their group
Yeah.
turn.
Already?
One. So now you get to go up to infection. Let's see, how do you disinfect an antibiotic resistant pathogen?
antibiotic?
Resistant pathogen.
How do you disinfect it?
Yep. How do you do it?
This is-
It's a trick
standard.
question.
I think it's a standard.
Standard.
It's standard precaution.
Yep, use a hydrogen
I said
peroxide by
bleach.
choosing the appropriate disinfectant. That's what it says.
Probably EPA, right? Y'all call it EPA?
EPA, yep,
EPF.
yeah. It was a trick question, because they said how, you just gotta pick the correct disinfectant, yep.
Disinfectant. 5.
Okay, clean. Name two types of clinical areas that could be located outside of a hospital an environmental service technician may need to clean.
Labs.
Yeah,
I'm gonna say offices.
offices, absolutely. Some other things they have on here is ambulatory care center.
Oh, yeah.
Long-term
Yep.
patient care system.
Yep.
Yeah. OR, was OR? No.
Well, yeah, ambulatory care, yep, that's
Yeah,
part of
okay.
that. And then
Oh.
clinics, they have on clinics on here also.
Okay. 5. 1, 2, 3, 4, 5.
Okay. Why is it important that you don't come to work sick?
Usually not, like, stop this,
Nice spray.
Display.
Yeah.
Display.
Yep,
Yeah.
it all spread infection, yeah.
Stop the spread. Yeah.
6.
Where am I?
Nikki.
Right here, too, right
You,
there.
you in,
Whoa,
you in,
gosh,
where's
I got
communication,
4,000.
communication?
So can
40,000.
Ooh, for the win,
For the win.
for the
For
win.
the win.
Oh my goodness.
Where can you find the dwell time for a chemical you're using?
On the label.
Yeah, absolutely.
Yo, we all heard that.
We got
You're
it.
in.
We in,
You
we
won.
got it, we won.
We have 5 stars.
We got
Oh,
that.
good.
Then you guys wanna
But they
answer?
won all the money.
Yeah.
Yeah, we can answer it.
Yeah.
They won all the money, cause we didn't win it.
Yeah, what I'll do is I'll let you guys can play it till you win
They
too.
got 4.
I'll let you guys roll 2 dice,
They can roll.
but they won. Yeah, go
They
ahead.
won.
Just answer
That's
some.
fine. Just to answer
Yeah.
questions.
Roll
Yeah,
2
roll
dice.
2 dice, so
Roll
you
the
guys
2
can
dice.
roll the 2
Oh,
dice.
put them together.
I wanna do it so you can win too. We all win.
Do we all answer
5.
questions? We all
Yeah.
answer.
Yeah.
I'm surprised myself, because I didn't answer all my questions right. I'm still baffled by that.
Okay.
How can you remove a scuff from a floor?
We just did that.
No, now how do you?
Oh, they said
no,
how?
How can you remove a
How
scuff?
can you move
If it's a
it?
scuff on the floor, how can you remove it?
Like, use a scraper.
Mm-hmm.
Yeah.
Or a map.
Yeah.
Mm-hmm. Or your foot.
Yeah, oh, that's what it says, or your foot, or your shoe, yeah.
Okay.
Perfect.
That's why I removed mine.
Yeah.
Something we'll do like that is, gotta have a good,
Oh,
that-
eight.
8.
1, 2, 3, 4, 5.
No.
Yeah, you're in communication. So, what does HIPAA stand for? HIPAA.
Health,
When you don't wanna
Yeah,
be doing
health.
this,
Yeah.
health insurance.
Health
Yeah,
insurance,
insurance.
absolutely.
it was health insurance,
Private.
I know it's it's not private, but I know it's personal information.
person,
Portability.
Portability.
Yeah, portability.
Okay.
Accountability.
And Accountability Act, yep,
Accountability
that's
Act.
it.
I just don't.
Wow.
Health
I
insurance,
know that-
portability, and
Accountability
accountability act.
Ask for the personal
Yes.
information.
We get it.
Yeah.
Oh, yep, and then it's right there, in the parking lot, at the bottom of the parking
I
lot.
don't have a
Oh,
parking
yeah.
Health insurance, portability, and accountability
Okay.
act.
Let me know, you
But
cannot keep
can
this
we
door-
just say private? Could you just say private
Yeah,
record?
Because
No.
they let me know, like, when I first.
Because that's
started,
what
Well,
she was
that's
gonna
what-
say.
I got
Well,
stopped,
health-
I got
well-
stopped, they was like, you cannot leave this door open, I was like, what? Because the.
Well,
all the
because there's
information
also,
was in
they
there.
say PHI a lot,
Okay.
personal health information.
See, that's what I want to focus on.
Yeah.
They sure let me know, you cannot leave that tech room open, I'm like, you know, because it's like about
Okay.
10, yeah, because of, yeah.
Mhm. Yeah, get you 10,000.
Oh, we get to 10.
Yeah.
So now we have 40 with them.
Yeah.
Final. Now I'm coming out.
Yeah.
Oh, is that 9?
Yeah,
8, 9.
clean. Name 2 specialty areas or departments inside a hospital that require specialized training you may not be responsible for.
Oh.
Yeah, MRI.
MRIs.
What else?
um,
OR, yeah.
OR,
What else?
and all doctor's offices.
ICU.
And ICU.
ICU, yep, and then they also have yep, NICU they have on here.
NICU.
Yeah, and they have
You
behavioral
gotta
health
remember
too.
NICU.
Me too.
Or could we say peds? No?
No.
We
No,
gotta say
that's
peds.
different.
Oh.
Just because we just got to that.
9,
Yeah.
15.
You can go in the waste for 10,000 points. When is it acceptable to throw patient records in the trash?
When?
Yeah, when can you throw patient?
Shredded. Like
Never,
started
shredded.
or-
I mean, after they're shredded, but when is it, but if it's not shredded, when is it acceptable to throw patient information in the trash?
When they discharge?
Yeah,
no.
are you gonna throw it out?
No,
Say-
I'm gonna shatter and then like,
So when is it acceptable to do it?
Never.
never.
Never,
Yeah,
yeah, it's
yeah,
never,
yeah. The word was never.
Yeah.
Yeah,
never.
we're- 10,000 for you guys.
Yay, we up there, we got 50.
Find you some stuff away, you know.
Yeah, well,
No, we have the one.
Well, they can answer too,
Oh,
or,
okay.
yeah, we all help each other out now.
Yeah.
Yeah, we just playing.
What you got?
Okay.
Yeah,
Mhm.
communication. What policy protects patient privacy? HIPAA. Yep.
Yay.
Okay, Wanda, we're helping them. we're helping
Yeah,
them.
everybody's helping each other.
Yeah.
We're just answering questions.
Yeah, wait till you, trying to get to the end.
Yeah.
7, yeah,
Seven.
yep, communication.
I'll never get that right down. Come.
Describe how you can impact patient surveys.
Oh my goodness.
Properly doing your job.
Yeah.
Yeah, by keeping rooms clean,
Keeping rooms clean and
Yeah.
properly doing your
Yeah.
job.
Because
absolutely.
that's one thing I would.
Yeah, I would put properly cleaning my, doing my job.
Uh-oh, we were on communication, yep, got it.
7. 1,
No, is that our?
Yep,
5, 6, 7.
another communication. If a phone rings while you're cleaning a patient room, what should you do?
Step out the room.
Step
Step out the room.
Yep,
Step out the room.
Yep.
Definitely don't stand
it says do not
there.
take the call in front of the patient.
Yes.
It says unless they are, unless it's a work call, step away from the patient, then
Yeah,
answer.
okay.
Yep,
Away from the patient.
Yeah.
yep, step,
That's not polite.
yeah,
In any aspect. That's not-
yep.
1, 2, 3.
Which one was that, floors? Oh, the floor's right here.
I was like, I thought they were
If
gone.
you see a wet floor sign and the floor appears to be dry, what should you do?
Remove the wet.
Yep, you remove the wet floor sign.
Yes.
Put it away. 3.
3. 1, 2, 3.
Waste.
Yeah, waste.
After waste from a container is removed, what needs to happen?
We need to clean the waste basket and then put in a clean bag.
Absolutely.
Okay.
That's what it says.
Well, that's
Waste
what the
container
girl
needs to be
did.
disinfected
That's what
and
it did.
prepare a new liner.
Yeah, that's what
Yeah.
it's in there.
To
That's
let
why-
us dry, you're supposed to let it dry.
And you know what you wouldn't know, like when I go on certain floors, like, oh, this is Miss Becky's floor, and I know I should keep it clean, so I have to do. Yeah.
4, 5, 6. I have.
Check the trash
Okay,
can top.
safety. Name 2 things you must do to stay safe if cleaning an MRI room.
Do not take the metal things. or
Yeah.
Nothing,
Yes.
nothing metal.
What else?
And jewelries.
Yep, a jewelry,
Yeah,
yep,
anything, that's what-
And magnetic things.
Yeah.
magnetic-
you got it. It
Yeah.
says no electronics, no jewelry,
Oh,
and then it says,
Not our cart,
yep, and then
definitely.
use specifically designated equipment.
Equipment.
Yep,
designated
That'd
equipment.
be something
Specific
to
designated.
to see that car.
Yeah.
driving around the
Designated
home.
equipment, that's what I gotta remember.
yep.
You wanna play?
Is it my turn or your?
Yeah, one last turn is yours.
When? We're using the same one. 4.
Waste.
Waste again.
What is the difference between trace and bulk chemotherapeutic waste? So you have trace chemotherapeutic waste and bulk. What's the difference?
The book is recycled.
We don't recycle any chemotherapy waste.
Yeah.
Like bulk is like. a
Bulk
less
means
amount.
it's a lot.
Yeah, I know that part, but I
Trace is
can't
like
be
a small amount.
And,
Yeah.
and then
Trace-
trace is
Trace
a
is small
small.
amount.
So now we.
One is big and one
One
is
is small,
small.
that's okay.
So what is the difference?
Yeah.
One is big and one is small.
One is
Bulk-
small.
I know
Yeah,
both
that's-
is big.
No,
but
that's
I
not,
would never
that,
got
but
trace,
where's
so.
the difference? Trace chemotherapeutic waste can go in regulated medical
Okay.
waste.
so
Well,
regular-
bulk has to go in hazardous.
Oh, okay.
Yeah, so if it's a lot, it's hazardous.
Okay, it's a
And
little-
if it's trace, it's just regulated medical waste.
Regular, regulated.
Regulated.
Yeah.
Yes. Mo, you wanna take your turn?
Yep.
I
4,
got the roll too.
Waste.
waste again. What types of waste should you never handle unless you've been properly trained? Remember the 4 category, no, it was 5. No, it was 4. 4
Yeah.
categories: regulated, hazardous, recycle, and solid. Which one should you never touch?
Oh, the regulated, I mean,
No, that's red.
hazardous.
Hazardous is the one you never touch.
Yeah.
Yeah.
Doesn't even sound like.
Yeah.
Mhm.
7, 1, 2, 3, 4, 5, 6, 7.
Waste.
Again.
What do you do with trash liners before removing from the container?
Make a tie.
Yep, you twist and tie to close the bag. Yep.
Was it my turn?
Yeah.
10. 1, do we go in?
Infection, yep.
Infection?
What is a pathogen?
It's a,
Germs,
it's a,
I would say, yeah.
something, I
microism.
was gonna say
Yeah.
a microism.
It's a harmful microorganism.
Micro.
Organism. Yep.
We got one more to go.
Yeah, more to go.
It's harmless, right?
It's harmful.
Harmful, that's what they
Oh,
Yeah, not harmless, it's harmful.
harmful.
Pathogens are harmful. Yep.
Oh, yeah, I'm,
Okay.
5.
we go same line or this?
That, yep, over, yep.
1, 2, 3, 4, 5.
That is safety. What color is used for fire in your facility?
Red?
Yep,
Red.
code red.
And
Yeah.
I can have, look at the
I can
things. No, no.
It's on there.
Oh, under.
Yeah, it's on you. Wanda, which one? 7.
1, 2, 3, 4, 5, 6, 7, 8.
Okay,
Yeah.
final question. What is one advantage of using microfiber over cotton?
The
It's
microfiber
more absorbent.
Yep, more
That's
absorbent.
one
What
that's
else?
stick with me, I remember that one.
and,
Light, easy.
It's
to
lighter,
handle.
yep,
Lighter,
have that.
lighter, more absorbent, I remember more
Yep.
absorbent. Okay.
Is there one more?
Well, there's a few on here. Well, you only had to name one,
Oh, good. 'cause-
but they have 5 listed, they have 5 listed. They say also it's more effective
Okay.
More effective.
and requires less chemical.
Okay, I know.
Oh, it requires less.
Yeah.
More
Great
absorbent
job, guys. Was that fun?
Yes.
It's the useful things. We can
Right.
run
Yeah,
around.
yeah, you
Yeah.
can take them home.
Yeah, it makes learning fun.
Yeah.
Oh, wait, no, I gotta separate them.
How do we, that's gonna say some of each of them, cause yeah,
You wanna take them home too?
I would like to.
I think I
Just
would
a-
take one.
Yeah.
And it would really be good.
Yeah.
Just, yeah.
I remember
Let's say I
that.
said what's up, I don't, you know.
Yeah, like flashcards.
Yeah. Cause it's a group.
And then Tracy went to go get lunch.
Okay.
So it'll be here, so if you guys wanna take like a 10-minute one, yeah, 10-minute break before lunch, stretch your legs and stuff.
I'll straighten that out for you. I know I'll get all the green.
Okay.
I'll get it.
You gonna get the blues?
I think we should-
Safety.
oh, we can mix together?
No.
Well, I usually put them like all the floors together, or the safety together, all the linen.
Linen together?
Yeah, linen together.
Oh, okay.
And these are safeties or,
Oh, I didn't know.
That's a clean
Oh, that's
one
okay.
like That.
That's a clean one.
yep,
Uh,
clean, linen,
Yep.
yep. Clean and linen, perfect. And then I put them on top of each other.
That's completely.
Thank you, thank you. Perfect timing, we just finished the game.
Yeah.
How about that for timing?
Okay.
Well, we all
We want
won.
everybody to win.
We all won.
Good.
Did they have everything right?
Oh, they did. He was very thorough.
I'm
Good.
gonna do a
Very
pop-up,
thorough.
pop-up practice, so they're gonna like review everything that we just went through.
Yeah, I'm not gonna remember, cause it's gonna.
Yeah, so that's why we,
it's gonna
that's why they
break
got
right
all
out.
these lines here.
You remember more than you think, Sharita.
I know.
Yeah. That's why they got all these lines here. Then we gotta fill out these. This is gonna be a part of the test, I guarantee it.
Yeah, so we gonna do all this together, right?
Mm-hmm. Yeah, then we'll be done. It'll probably be about 2:30.
See, for me, the only issue is not that stuff doesn't stay. It just erases it, but it does come back. Which that's a part of the menopause, and I know this, so I try to, you know.
No, you're not using menopause.
No, but remember the fact that because people always talk about hot flashes.
Yeah,
Nobody
yeah.
talk about the fall, yeah.
Mine is just foggy, period.
Look, stuff just will leave, and I'm like, what the, but it comes back. But it takes a minute, but it comes back, and I had to, you know, I'm like, okay, I have to remind them, like, what, I'm like, what am I doing? Like, stuff just, and I be so.
I haven't gotten that
I
far
can't,
yet.
yeah.
Thanks for helping.
Thank God I haven't gotten that far yet.
Let me wash my
Yeah, but
hands.
here's the thing though,
I'll be right
they say it can last up to 10 years, and
Mhm.
so now I've been in it.
For a while.
Yeah, years, I'm
For
like
years and years.
I'm
I-
57 now, so I started, you know,
I'm 62.
right, I'm
so
saying, like
I know
around
what you're
50,
saying.
yeah, right, and it's still, but then I read up on it, I wanted to check, and I was like, really, what the? They say, yeah, the symptoms last up to 10 years, I was like, yeah, are they serious? But you know, as the years go on, and you see you still, I'm like, it's like I work in
I
places.
just got off
Look,
my
I work in places,
administration.
I work in places, people like, oh, it's so cold here, I be like, I'm like, how come you're not wearing a jacket?
I love it. You should see me. I don't want to wear it. I'm sweating all
It
damn
feels so
day.
good. I mean, I got so many portable fans that like go around my neck. And last year I
I
was
bought
walking with it
that
at work.
Arctic Air.
Yeah, I had that too, the little thing.
Yeah.
I had, look, last year I was walking to work with the portable fans around my neck. and
Yes.
I got 2, 3 of them, one right beside my bed, one on the chair.
It's important that we have to go through this.
Yeah, that's crazy, but yeah. So we're not here right now, right?
We taking a break.
No, I'm saying with this one.
We done. We on here now. We on top of. Well, she's gonna ask us some questions back here. I'm quite sure what she's gonna say. Right here, she's gonna say, yeah. She's gonna ask, we gotta do this and then we're gonna do that last pop-up one. Cause we gotta finish this. Remember, we didn't finish all that. We only finished
This
this.
is another thing, like, see, one time walk off of it. Just like I'm like, what is that?
They'll come back with this. You know what I do? This is how I remember it. Like she said, read.
Oh, those are
That's
the
what makes me
shelves,
remember.
the,
That's what I was
those are
like.
the shelves.
Shelves, oh, the shelves, okay,
And
got it.
and how you call it, and the,
Oh, I'm ready to put the stuff out that needed, or no?
I'm taking out.
Oh, the shell.
Yeah, the shell
So
shells.
it's set up.
Yeah, I think it makes it easier to set up.
Big box is there.
Yeah, that's all
I
right.
know, these you could travel like a small animal,
We got chips here.
Oh, yeah, that's my favorite.
Oh, they got.
Oh, you know I love the chips a lot. Oh, hallelujah. Hallelujah.
You can have a big.
Yeah, and one of the boxes.
Yeah. Oh, I found out.
I mean, what we just talking about that?
Found it.
Oh, here, there's more of the.
Yes.
Yeah,
no,
that is
we all
Yeah,
did.
because you have to do the minimum for catering, so we kind of know.
I think it's for all of us.
I know.
There's tomatoes and. Yeah.
Oh, they got.
We got a lot. Got a lot.
Yeah, mine is only 5 of us. I mean, and everybody had, I know.
Sometimes I overshoot things, but.
You never know how hungry somebody's gonna be.
Exactly,
Yeah, that's true.
and then, you know.
Here, too.
Thank you, Mary.
You're welcome.
That's true.
From that, right?
I think, yeah, because I have an emailed receipt, but then also,
I'll give them this one too.
yeah. But I believe it's coming to my email, and then here's the hard shell.
All right.
Does anyone want a taco bowl?
Yeah.
Okay, so I'll put the bowls on the plates and then you can fill them. You gotta use a.
I think everybody ordered one.
Oh, taco.
All right,
yeah.
yeah, keep all that stuff together, if you don't
Okay.
mind, yes.
Taco bowls.
Mhm. These are my favorite.
You want one, Kapil?
I think.
You wanna try?
You think?
Try it.
You like, you gotta try it, try
Come
it,
try it.
try it. And then you put everything right in
You
there.
really won't- I don't think you're gonna say, eh, and you eat the whole thing. You eat this too.
You eat it.
Yeah. You eat all of it.
Veggies.
You gotta eat all of it.
Oh, okay.
Yeah, it's eatable.
Edible.
Not eatable.
I never
Oh,
had
give me
this
a
kind of
spoon.
stuff.
This-
Oh,
Oh.
salsarita.
You never had salsarita? It's
You
good.
never had tacos.
I do, but like a small one.
Like
The
a
shelves.
I never make myself.
Guacamole.
What? You know what? I'm gonna put this one on the table so then Rebecca and Kapil can start making, because these are the same.
Yeah.
Would you like a taco bowl or are you gonna do like shells or something?
Yeah, you asked for
I
it.
did.
Oh, I don't know. I'm just asking everybody.
Yeah,
Yeah, I ordered a bowl
Just
for,
making sure she's getting everybody a
definitely
bowl.
for
Cause I have to
Sharita,
get it out with
Yeah.
tongue, so.
and then
you know.
Wanda, and then I ordered a bowl for me, and then I just ordered extras. Just
There you
Okay.
go.
This is the bowl?
That's
Yeah.
the bowl. Then you put everything in the bowl.
I thought we
No, it's a
put it
taco bowl.
I know.
No,
No?
when I ordered one too before, I was like, oh, shoot, let me find out we can eat this. And then I started eating it, and I was like, I got you.
Have at it.
Okay, then I'll put these in here.
Oh, okay, all right.
So
All right.
definitely want lettuce and tomatoes and.
These in. Here's another one for topping.
Yeah. Then the all.
Oh, yeah, that's why I remember when she.
Hey, Kate.
when she ordered this. Remember on the top,
You're
yeah,
gonna be
'cause I
on my
remember
phone?
when the beans, on the right.
Whoa.
side.
I think
That's not-
Felicia is.
Yes, I am.
Got it.
Yeah.
Don't you think so? Like, do like put it together, yeah. Because it's easy to move.
Yeah, just do help, just dig in.
Kate wants anything, we have a ton of food.
Dig in.
You want a
please,
bowl?
There's tons of food.
Yeah.
And then there's lemonade too. There's raspberry pink and then,
You got drinks instead of water?
Are the tongs in there? Need the tongs?
nope.
No, where are the tongs? Oh, here they are.
Yeah, because these are no.
Here, I put these right on the table.
Yeah.
It's our celebratory meal. The raspberry is really good.
It is?
Oh my God, it's amazing. And then there's salsa and guacamole and everything over here too.
Okay.
Look, anybody want me to make them some nachos?
Yeah, I'll take a
Okay.
little bit of nachos. I'll take this one.
I take too. I like the nachos.
You like the nachos?
Yep.
Yeah, I like the nachos.
You want salsa? You want salsa on the nachos and cheese?
Yeah.
Or just both?
Just the sauce.
Just
not the-
cheese? Or what? Tomato sauce or just the cheese? Tomato,
Tomato sauce.
okay. You like medium or mild?
Mild.
Oh, that's the same thing that's on the table. Oh,
It is?
yeah, I just put one on the table so you didn't have to get up.
Yeah.
Oh.
But that's okay. I'm just saving some steps, but that's okay if you didn't. Do you like guacamole?
No.
No. Okay.
Is this salsa back?
Oh, yep, that's salsa there.
The big one is mild, the little one is medium, and then the other one's pico.
So Camille, you want this on yours? Okay. Just put it on there on top. It's good.
Yep, it's good. Thank you. Thank you. ma'am.
More?
That's all.
No, that's all? That's only a little bit.
Yeah, if I want it, I. do.
Okay.
I will. Thank you.
You're welcome.
I'm taking one too. Felicia.
Take, huh?
A nacho.
Oh, yeah.
No.
You want, you want cheese on it or salsa or both?
I never made it.
Yeah, we never made one either.
Oh, and maybe, oh.
That's queso?
Oh, really?
That's queso.
Even in my
They
house.
got queso. I really don't care for queso.
Oh, you don't want, so you don't want cheese on it?
Yeah, I'll put it on there.
That's
Okay.
like sacrilege. Queso's like liquid gold.
That's what everybody says.
Oh,
I said,
Becky.
grab some
Do you not
more.
like cheese? Are
I
you
do, I
like-
really don't, 'cause it
Yeah,
binds you.
that's what you find,
It
yep.
binds
And you want
me.
the
Yeah,
salsa right on it?
it
Who would
binds
like
you
some
right up.
lemonade?
Me, I normally you drink, but. I don't-
Pink
That's
or
good, you want
regular?
more?
Nope, that's good. That's good.
Yeah,
That's good.
got it.
Thank you, thank you.
Pink I highly recommend.
Okay, I will try.
I'll do some pink and I'll do some regular.
Want me to put you some nachos on the plate, Maurice?
Yeah, you could.
You want salsa or just cheese or both?
Mhm.
So that's what I'm getting, 'cause I can't.
Medium or mild? Or pico de gallo?
You want the red stuff?
Medium.
Yeah.
Pink or regular, Miss Becky?
I'll take, regular.
You go, Capille, pink or regular?
Pink, I think.
Wanda, pink or regular?
Mhm. It's our last day, we gotta celebrate.
Mo, would you like pink lemonade or regular? Sharita, would you like pink or regular?
Okay,
Pink.
I'm gonna eat in a minute, cause I have to jump on this call with
Okay.
Kate.
Can I
So
get
I'll be
nachos
back.
too?
Oh, yeah, well, yeah, I'll put them on the plate right now.
Thank you.
You're welcome.
Thank you,
It's
Donna.
just hard to get them on there, so I'll get.
Yeah, there's
Well,
plenty more
this
meat
one's
too.
mild,
We
that
have
one's
two
medium.
more.
And then that's
Mild.
cheese.
Now, yeah.
The cheese is good on there too.
Oh,
No,
that's a
the
good,
queso.
that's a good looking bowl.
It is.
Oh, this?
Yep, that,
Oh, it's very nice.
that's good?
Yes.
You got everything.
Yeah, it's delicious.
You got everything.
I'll be
on
back in a
yours.
little bit.
It looks nice.
Yes, you should. I'm like, this is, I would like that in my bowl. I like.
I buy guacamole almost
Oh, I
every
love
week.
guacamole.
I wish I
Love
just knew how to
making
make it.
Oh, it's so easy to make.
Everybody keeps saying it, but every time I make it, it comes out too sour or something. I'm doing too much or something.
I'm trying to think.
I bought the avocado, I chopped it up, I bought the tomato.
I mixed it, yeah.
Yep, I mixed it and added lemon and lime.
Mm-hmm.
And,
Some onion, some garlic,
oh, okay, well, that I
and put
didn't
in,
put in
and I
there.
put in a tiny bit of jalapeno.
I love jalapenos. But yeah, I didn't put in jalapenos.
See, do I do lime? I don't, you know what? I don't do lemon in mine. I don't know if that makes a difference.
Maybe that does. That's probably why mine doesn't taste like, I do.
The cheese is good.
Okay, this is, yeah.
You can never have enough cheese.
Yeah. So much time.
The tacos look good, though, don't they? It's so
I know,
soft.
he gave us a bunch of them.
You did? Oh, soft tacos?
Yeah, they're soft and hard ones too.
Oh.
We'll be eating for days.
But good, you guys will have it for later.
Yeah.
Put this down. I can't, no, you're fine. I can't grab that.
And then that's just like onions. Did anybody get, there's peppers and onions here too, because I know you
Mhm.
ladies wanted veggies.
I got it. I got
Sherry, did you
it.
get some peppers and onion?
No. I got everything.
Mind your way.
You can't eat
Thank
it.
Thank you.
Booty booty.
Are Mama your way?
No, her way.
My way?
Yeah, close it.
I'm saying, should I go under? I wasn't sure.
Yes, I am. You okay?
There's another one.
Yeah, are they on or no?
The pico de gallo is not.
Okay, yeah, I want some pico de gallo.
Hot sauce, good. Love it.
Mari, Madeline, pásame servilleta, por favor. Ya, para que lo pongas ahí. ¿Ah?
Paper towels, thank you.
Pollito, pollito.
Good, ain't it? Oh, they got the onions and stuff over there.
Una bing bing, una bing bing.
Oh, thank you. Oh, thank you so much.
Oh, he did he?
Yeah.
Well, he did get out my stuff from storage for ESB, so I can't tell him no.
I know.
It really is different. And you tell they make their shells, I mean, they make their own.
Yes, yeah.
Mm-hmm. They make their own shells, I
Yeah, the guy
watched
was
them do it.
making it as we were
Yeah.
going in.
Mhm. I used to sit there and watch them do it. I love jalapenos, but I know a lot of people don't.
I don't like.
My favorite.
Don't forget your,
I hardly
Oh,
can
my
eat
goodness.
anything without a jalapeno or anything without hot.
What is that?
I say my husband,
I love hot.
They're not
my
mine.
husband, he
I cannot
loved it.
I love it. Love it to death. To where my doctor
Tell
told
you
me to
everything's
calm
hot.
down with it. It's like you're going too much. I'm like, but I gotta have it every day. You say you don't.
I know, you know what, that's the thing, my eyes are bigger than my belly sometimes.
That's right.
I'm gonna finish.
Yeah, that's right.
Yeah, I'm gonna put some pickle.
Oh, yeah, there you go.
Yeah, that's what I'm using to do for.
I don't care about
Is this mild? Medium. Fish
You
looks
figured it out?
medium.
Just need some pico de gallo and that's it.
There's another pico de gallo too.
Oh, this
No,
was
it's right
fine.
down the
She's
street
really
from
good.
us,
That's
right?
fine.
On Chippewa, Doritos.
Salsa Ritas, salsa Ritas.
Yeah, right in the Hampton.
Yeah,
I'm done. I'm leaving. Bye-bye.
well, it's right down the street from Ted.
Oh, no, I'm missing my lemonade.
Oh, you can't be missing your lemonade.
There's one open here.
After I made a phone call for the lemonade.
Are you going to
Wanda,
that?
I told you I was getting that lemonade.
Are you going to that meeting too?
No,
Felicia's on it.
yeah.
Kay was supposed to be on it too.
Okay, yeah, I think that's why she came over to see if I was gonna be on it.
I told her, she was
I
like,
told her to stay and have lunch.
Yeah, why didn't she?
Oh,
oh, no. Hi, my baby. Hi.
thank you.
Sure, San Maria?
Oh, yeah.
She's probably not gonna mind.
But maybe she'll have some veggies.
Yeah, I'll let her know.
Yeah, let her know. Come on over here and get a plate.
And sit with us for a change. She's always on the move.
Okay, yeah, I thought about you.
Good at
Sure,
what
you
you
guys
do.
are all feeling okay? And realizing it's literally the stuff you do every day. It's just putting it into.
Yeah, but why do they have to put it in different words?
Because they do.
Yeah, that's the way. I
But
think
don't
the
freak
word-
out. And you know what?
That's where I'm freaking out from, the word.
No, but when you do the test, although they make us sign something
Yeah,
that
like
we're
it's
not gonna
hard to
help
remember
anybody,
the-
we'll sit with you guys and. Trust me, nobody will be left high and dry.
Okay.
And sometimes it's a matter of just seeing the words on paper. And then plus remember too, it's multiple choice. But when you
I
think of the
know,
same answer, don't
Tracy, but
go with
it's
your
still-
gut.
Go with your gut,
Yeah.
don't second guess yourself.
No. Cause I remember when Loke and Tika were doing it the last time,
Mm-hmm.
they had the answer, then they were like, oh, maybe it's this. It's like, you'll drive yourself crazy if you do that.
Yeah. To make it confusion, I think.
Yeah, it
To make you
does.
confused.
You guys will be fine.
Okay.
Totally fine. Yes, you will. Everybody be good.
Hmm,